Good afternoon. We are back from break. It is 1:35 p.m. and we are kicking off this afternoon with Public Health and Social Services. Nicole, anything you need to add before? Okay, passing it forward to Director of Public Health and Social Services, David Bain. Go ahead. Take it away.
Thanks. I'm David Bain, the Director for Public Health and Social Services here. I wanted to take a minute to introduce my team real quick. So we've got Corinne Marson, Dr. Jenny Freiheit. The rest of my crew is online watching. I didn't want you to be flooded with my team and this other table, so that's gonna be the gang today. I want to start by just saying thank you for the chance to present this budget. For most of you know, this is my first budget for the county. I spent a lot of time and energy sort of thinking through what it was that we needed to ask for. When we started this budget process, we really weren't aware of the county's budget situation overall. But I will tell you that as we've gone through this more and more, I feel like we've got really good confirmation about why the state funds us the way that it does. The theme you're gonna hear from me is funding our core foundational work at public health. I'll start with really looking at the high level for our funds. So at the next slide.
You get to control it.
Oh, sorry, I thought you had this.
Okay.
I'm not touching this.
Oh, boy. Oh.
Yeah, thank you.
Oh, do you want to do our mission first? Sorry, I jumped.
Yeah, I was like,
There
you
you
jumped
go.
in. Okay. Our mission is pretty clear. I'm not gonna read this out loud to you all. I will say though, this is what drives sort of the work that we do in public health. It's been an incredibly difficult last really 3 or 4 years for this department in particular. And I wanna say a public thank you to our team that worked during the COVID response. Part of what our budget is looking like is also a response to COVID. It's lessons learned, it's after effects. And so again, I want to take the chance to publicly just thank the team who worked incredible hours under duress and enabled our county to get through a really tough time. Okay, next.
There we go.
Sweet. This one will be just a really quick review. I want to spend most of our time on the actual change request, but I wanted you guys to be able to look at the various funds that we manage on the public health side. Most of these I think you're familiar with. There might be one or two that you might not be, so we'll just go quickly through that. I will say up front, this is where I lean heavily on Corinne for her work, so Corinne, jump in at any time on this front. So we help manage the TST fund, which is the one you see first. We have the Veterans Assistance Fund, the Housing Fund, the Public Health and Social Services Fund, a new fund, which is Fund 1540, the Opioid Settlement Fund, a Technology Fund, and the Environmental Health Fund. Most of those probably seem self-explanatory, but I will note that the Public Health and Social Services Fund is the primary fund for most of our department. The exception, of course, is out there with housing and veterans assistance, but most of our sort of core programs are falling under that fund. Next slide.
2025 on this page.
Okay, keep going. I want to make a quick point here that I hope will also sort of color the rest of the conversation, which is we are a department that has very little in the way of general funds from the county. We have estimated that we've got less than 5% of our total budget is general fund. So we rely really heavily on other sources of funding, primarily the state, some from other, some federal agencies, but we are minimally funded by the county. And I say that not in a disparaging way, but to note, as you're looking at my budget, you'll notice that I'm not requesting much in the way of general funds for our budget. There, I think, are 2 areas that we looked at, but everything else is going to be other funds that we're using. We have really a handful of positions that are currently tied to general funds, 1.5 to be exact. So next slide will show the bulk of our positions. So this is the bulk of public health and our FTEs. And again, this is other funds. These are not from the county. The 2024 proposed, 2025 proposed is our current number of FTEs. That also includes the vacancies and our proposed number of FTEs. So that's a big number because it has everything in it. Next. Again, I'm not gonna read the slide in its entirety, you guys can read that yourself, but I just want to note that for us, the key challenges you're gonna hear from me aren't news to you, right? We've got backlogs, we've got turnover, we've got staff who have increased demand over the last couple of years. And it's across our divisions, it's not just one division. Environmental health feels it, our communicable disease team feels it, our child and maternal health team feels it, it's across the board. One of the things I want to be really cautious about, and I put this in the slide, is you'll hear the term sort of post-COVID used. In many ways, I think that is maybe sort of inaccurate. I mean, we are no longer in the emergency response phase, so I think we can say that we're post-response, but COVID is still here. You know, we were undergoing kind of a surge the last couple of weeks. And I think the impact of COVID is still here, both from a personnel perspective, a disease burden perspective, and also a funding perspective. The big picture for me, as I've come in as a new director, is really having a chance to look at our gaps and our deficits in the department. I think this is really the crux of my request, is sort of noting that as a department, we've done a really good job of making it work with the equivalent of duct tape and glue for the last probably 2 decades or so. I think it's important for us to be honest about where we are as a department. It's not that our staff aren't working hard, they're working probably twice as hard, frankly, because of the gaps. But I think we're talking about challenges. I have to be upfront and say we have significant gaps across each of our divisions. Next. Okay, so it'd be fun to leave it there and say that we have gaps and walk away, but we do have some opportunities. Obviously, the most significant fund source that the county has taken on over the last couple of years for public health is the Foundational Public Health Services funding stream. And so I'm noting in here that we've got specific funding in place that acknowledges that departments across the state have had these holes for decades. The intent of this funding was really clear. It was to fill these gaps. And knowing that depending on where your county was and what the makeup of the county was, you could have vastly different health departments. Which is an inequitable situation. You shouldn't be able to have a better service in Pierce County than you do in Thurston County just because they have maybe different funding structures or a better tax base. So the idea was to have everybody up to a baseline that was equitable and would work for the community that you lived in. And so I'm noting that our request is really driven in large part by that funding. And the idea again is that because we have these gaps, I want to be able to use that money to fill those gaps. The other things that I want to note in here too is that this isn't the end. This budget isn't just about filling our gaps in for today. The point is that I also want us to be looking forward to the future. I want this department and for the county to be able to have an accurate assessment of where we are as a county in terms of health. Right now, to be perfectly candid with you, I struggle to feel like we have the most accurate assessment of our various needs. I can sort of make best guesses, I can use data from the state, but we don't have a real accurate picture of our disease burden and our inequities without having capacity to do that kind of work. That capacity does not exist in the department right now. So when I talk about core functions, it's not just core functions that are the traditional, we've got folks doing septic inspections or folks doing NFP work out in the community. It's also, I think core work also involves assessment and evaluation. And so that's part of our budget too, is we're asking for capacity for the future. It's not just for capacity for today. Okay, next. Okay, so we will get into it from here. I want to pause if there's any questions you've had so far for this sort of these intro slides. I want to make sure I have a chance to answer any questions you've had.
I understand what you just said. Just to use an analogous context that I work in, the salmon recovery world,
Yeah.
We're always talking about monitoring versus, everybody wants the money to go to on-the-ground projects. And nobody really wants to fund any monitoring of how those projects are doing and where they were successful to try to, drive. So it's always a battle. And it seems very analogous to what you just described. And I can't say that in that context there's been enough of a shift. I guess you're getting out ahead of that in a way. That's probably good thing for us to think about, trying to find that right balance in terms of resources.
Yeah, and I think the sort of the beauty of it is that with the kind of positions we're requesting, it's almost like a 2-for-1 deal. Like you're resolving some issues that are literally here today. Like we're struggling to do some of our mandated services, but those same positions are also gonna help you in the future, right? They're also positions that'll help you anticipate future epidemics, future outbreaks, help you with the growing population when it comes to our nurse-family partnerships. And so again, I want you to think about our positions in a kind of a dual way, which is today we have holes. These positions will also help us in the future, moving forward.
Is there any kind of like, probably not based on what you said, but I'd be curious if as we move forward, you know how like when we get a contract, we sort of have 15% admin or 10% or whatever, like there's kind of a rule of thumb.
Yeah.
And it's like, as this kind of work gets more accepted and developed, I'm wondering if like they'll just become kind of a best practices, like, hey, budget 20% of your resources toward monitoring, adaptive management, and future planning versus the on-the-ground core service delivery, something like that.
Yeah, I think you're seeing it. I think the CDC, which is where the bulk of public health funding tends to come through at the federal level, I think has put a really heavy emphasis on this idea of like surveillance and assessment and sort of getting out in front. I mean, COVID really was this proving ground of where our limitations were as a country and our ability to sort of track and catch things. And I think as a country, we did pretty well in catching up really quickly. But a lot of that was a lot of temporary funding, a lot of temporary surging that probably should have been built into the system. And that's not just Thurston, I mean, that's across the board. And I think when I talk to my counterparts, both at the county level and also at the state level, I think folks are really trying to build in their budgets this capacity to avoid this happening again in the future or not being caught flat-footed. And it's not, again, it's not just COVID, it's other issues too.
Absolutely.
Okay, so we'll start with our first request. We've talked a lot about this and other meetings with the board, which is that we did receive additional funding for FPHS this year. In the big scheme of things, FPHS is a growing fund source at the state level. The intention of the original legislation was for there to be, I'm gonna get the number wrong, but it's basically like a 6 to 10-year plan for the state to invest increasing amounts of money. And at the end of the process, we'd have a point where we'd fully fund the public health system in Washington State. We're about a third of the way into that process right now. So every year you'll see increases. Now, some years those increases were large. So before I came, you guys got pretty significant jumps in funding. This year's increase was still significant, but not as large. And I think that's gonna be pretty typical. In the next couple of years, you'll see marginal changes. The idea is that theoretically, counties should have been using this funding to build their core, and you shouldn't have the same kind of needs in 2 years as you had 2 years ago, if that makes sense. And so the funding you guys got in the past, which I'll talk about a little bit in the second priority there, we have done a really good job of allocating that funding across. But my number one priority was to deal with the new funds. So almost $1.2 million in new funds. This hits a couple of categories. I'm gonna talk about this with the help of a little chart here. There are 6 new categories that were added to our sort of FPHS list in this funding level. Funding for, they're calling it immunization outreach and response, EPH leadership, public health communications capacity, emergency preparedness capacity, opioid use, but it's a very specific use of that concept, and then strengthening fiscal capacities. Those are all areas that across the state, jurisdictions identified as being really key places to move towards for new funding. For us, when we looked at that, it lines up with our needs really well. So that first bucket I mentioned, the immunization outreach and response, this is the COVID team that you've been operating for years. This is funding that would support them and the work that they're doing. EPH leadership is funding that will go and support a structure in our department that has really been understaffed from a management perspective. We have a significant number of FTEs that are doing work on the ground, but we have been relying on a few people to actually monitor and manage that division. Our public health communications capacity, this is an area that I think every LHJ outside of King County has struggled with their ability to have an effective communications team and communications funding. EPR capacity and infrastructure, another one where COVID really exposed just how little we've been investing in EPR. Our opioid line here is a very specific item related to the idea of supporting families, particularly pregnant women, pregnant parents. And this funding is specifically going towards each jurisdiction adding a coordinator position to work with families on opioid use. And finally, the strengthening the fiscal capacity. I don't have to tell you all, you've seen the struggles we've had as a department to maintain a strong fiscal staff. And to be clear, we're not alone in that one. And so they added funding specifically to increase support there.
David, can I,
Yeah, go ahead.
is there like a chart of this? I'm a visual person, and so I need to see if you can do the categories and how, the positions that you're walking through right now and how they fit into each category. That would be really helpful to me as I'm seeing the list of this request and connecting them back to those specific buckets. So, not, of course, now, but just
Yeah.
before deliberation, we go into deliberations, it would be really helpful for me to kind of see that, a little chart or something like that, something visual.
Be happy
please.
to. Yeah.
Thank you.
Any other questions on this item while we're talking about that? From either?
I think you have an item later, but I guess I'm just wondering about the support for the Board of Health. And, because it sounded like that might fit into one of those categories, but did you have another way to fund that
We can talk
position?
about it now, it's totally fine. It's kind of at the end of the presentation. Again, we did this prior to knowing about sort of the county's fiscal situation fully. The idea was that we would need additional support to support the Board of Health. That was one of my, I think, 2 general fund requests at the time, was to use general funds to support this position. I think after having conversations with the assistant county manager and others, I think there's enough flexibility there that I think we could look at FPHS as a fund source to support that position, or at least partially support that position. That is a possibility, yeah.
How many dollars are you talking about out of the general fund
For that position,
total?
oh, like for that department, about $1.2 million.
And I guess I'd ask, I'm gonna just ask why, if they're health related, are we using general funds?
There are things in public health and social services that we can't use the revenue streams for. And then there's not many, but some of the grants that we get require match. And then in the Nurse Family Partnership Program, a few years back, we accepted funding that came with a maintenance of effort requirement. And we were putting general fund in for NFP then, so it's a fixed amount. I can't tell you just off the top of my head how much, but we could look that up. So there are reasons that we're putting general fund into public health. We've asked Corinne to come back with a detailed worksheet of where exactly the general fund money goes in public health. She's working on that. And that's how, if you recall, when we were reviewing non-departmental, we said we could decrease that transfer to public health by $100,000. That's part of the work that she's doing in sorting out how much general fund do we really have to contribute. But there are.
That's my question. We've never been in this situation before.
Yes, I understand,
wanna
and
review
we
that.
have asked Corinne to do that, and she's working on it.
Almost done.
And I think that we can fund support for the Board of Health.
I think we could.
Because you're talking about communication, you're talking about, and I can't remember all the 6 buckets you just mentioned, and those are the 6 additional buckets. I don't even remember, but I mean, if you look at what the Board of Health is designed to do, it's
It's all about health.
connects connects to those things.
So maybe when you give us the little chart, could you add the Board of Health and where you think it would kind of fit in?
Yeah,
And
I can do
then
that.
when we're doing the deliberations, it can be a consideration on like, okay, well, there's only enough funding for this, so which one are we gonna,
Yeah, we
So-
can definitely do that.
that would be helpful, I think, for, at least for me.
Perfect, okay.
Thank you.
Okay, I think you were asking for feature tense, looking at, the layout of these fundings. I'll describe some of the positions though that we're trying to fund with that first one. So we're looking at, the, new EH program manager. We're looking at, a couple of new epidemiologists, which are the people I talked about before doing assessment work. We're looking at, some additional staff for communications. We're looking at, new program manager, in our MCH work. We're looking at supporting our COVID team. We're looking at that parenting substance use coordinator. And we're looking at, a program assistant for EPR to support that team. So it's on the slide, but basically we're looking at about 9 positions, that we feel like meets the categories within those things. And as I was working with the steering committee for FPHS and looking at their sort of instructions, their intent for for this funding really was looking at people. That's really where the holes are in public health is personnel, and so that's really where they're trying to direct the money to go.
Can I?
Yes.
I mentioned this at the Board of Health, but I'm just kind of trying to bring it back up again.
Yeah.
Seeing how the market and it is very difficult to hire again. And 1.1 million, well, it's great, right, that we're getting that funding and you know, these positions sound like they fit right into those buckets. My question is in regards to spending that money down, seeing that we might not be able to hire
Yep.
all these positions by June. I mean, hopefully we do and we're, you know, they're up and running. But if we're not able to,
Yeah, what's the contingency?
what is the contingency? Because I just don't want to be put in a situation where it is
May and
May
I'm
and then
coming
we're
to you.
like coming in with these last minute proposals of trying to like, where does it fit, right? And since these are very specific buckets, I would kind of want us to start having at least a contingency plan and then if we're not able to
Yeah.
fill those vacancies, at least there's something.
No,
That-
Oh, sorry, go ahead.
Just to say that that will always be an ongoing kind of dance that needs to occur based on the nature of the funding cycle. Given that we're a calendar year planning for a a 2-year period versus the state, which is also a 2-year period, but offset by 6 months. So there's always gonna be that lag.
go ahead. I'm gonna respond to you too as a commissioner, but I wanted to get your question too.
Actually, I wanted to ask Robin, what is the total public health budget in a percentage of our overall total budget? Is it like 1/3?
I'm gonna ask Nicole to quickly look that up.
It's gonna take a minute, so can we come back to it and I'll get that answer?
I thought maybe you had a pie chart or something that showed it. Usually you've got
Not
pie
handy,
charts.
Not handy,
but she'll
but we
be
can
able to
find
look
it.
it up pretty quickly.
Going back to Commissioner Mejia's question and comment, I've had the same sort of thought process. So when I was hired, I came in as we were trying to spin down last year's. And again, a shout out to the board for helping us to prioritize those funds. And then even after that, we still had some additional funds that I came to you towards the end of the summer, or beginning of the summer, to help support some infrastructure upgrades to the department, to the Lilly campus. My thinking right now, and I'm open to conversation with the board, was to have some periodic check-ins as we are moving along the process. And there's a couple of maybe like green light, red light moments for us when we're looking at our spend or looking at our vacancies, where we say, okay, we should meet with you as a board and talk about, you know, we're in, my thinking would be really looking at maybe March and seeing kind of where we are at that point. And then us coming to you with a couple of proposals and ideas that you can kind of choose from, rather than starting from scratch. You're right, this one's a little trickier than last year's because they are fairly categorical versus last year we had a little bit more wiggle room with some of that funding. But I feel confident about our department's ability to hire, but I am looking at the market and saying, yeah, I think there's gonna be some positions that are just gonna be hard. I completely agree with you. I think a reminder to the board will be that if we make decisions for that funding, the unspent money, it would be a one-time expense. And I would anticipate going ahead and still filling that position in the new fiscal year, if that makes sense. So, between March and June, if we need to cover the communications funding temporarily, we can do that. But July 1st, I'm expecting that money will be back in our base. I'm hoping that I would have that position at that point, if that makes sense. So any
So you
maneuver
need
would-
like a roster of one-time expenses essentially that
Correct.
can just plug
So
in
exactly, so
by
the
category.
the vacancy savings at that point would really just be, literally be one-time adjustments that we'd have to make, which is what you guys did last year, kind of, which is the second priority. So some of the decisions that we made, both before me and when I was here, involve some adjustments that we need to come back in and kind of complete. Not a lot, you see that amount isn't a whole lot, but I'm gonna bring up a couple. One, and I actually really appreciated this adjustment, I think it was Commissioner Mejia actually brought this up. You guys approved a medical assistant as part of the funding, I think it was 2 years ago, it was a while ago. We had some really good conversations about, would we be better served with a higher class of, like, a nurse or a nurse supervisor versus a medical assistant, was where the dialogue went. I went back and watched the meetings, make sure I got that right. And I completely agreed. So you're seeing here is that position being reclassed to a nurse supervisor. That's an adjustment from the funding you gave us last 2 years ago, or authorized 2 years ago. We also had a position that really focuses on our sort of mental health work. And that position was authorized by the board, but we didn't actually get it into the budget process in time. So we hired someone in a temporary position, knowing we'd come back to the board in the budget process to get it become permanent. So that's another position you'll see in that you previously authorized the funding, but we hadn't done the accompanying work of adding the position as a permanent position.
What is the position?
It is let's see, an education outreach specialist too. And it's a position that really works in our nurse family partnership area, the child wellness division. And they do work with mental health particularly is kind of the focal point for that.
We created a temporary position since we were outside the budget cycle, so we could get the work done, spend the money, then coming back now to say, oh, we need a permanent position. So that was how we got the request through, hired a person, and now requesting a
My question was just less about the money and more about what they're actually doing, because you said mental health and I didn't, we don't do a lot of mental health stuff, so I'm kind of wondering, what are we doing? And then
Yeah.
you're saying it's related to the nurse family partnership, so I'm trying to figure out.
Yeah, well, this is a growing body of work for us. Like obviously, we're not the primary mental health service provider for the county, but like when you look at what our nurses are seeing and what our folks are seeing on the ground, like we can't ignore the fact that mental health is a key part of this. We're seeing higher acuity cases. This position is one that I've already seen the benefit already. They're helping us with education outreach ideas, programs, campaigns, social media outreach. So really supporting the work that it's like automating the work that we're doing already with the mental health focus, right? So we've got a core body of work we're doing with these families, and now we have someone who's an expert with mental health, if that makes sense.
Does that connect to the families that are being worked on, or is this
Correct.
more general?
It's both, so they're able to work on both ends of that. And again, you're gonna see, I think, not in this budget, but in future budgets, you're gonna see more and more, I think, desire for public health to be sort of more proactive in this space, so.
Thank you for those questions, because now I'm a little, where is this position? I'm trying to, I was looking for the little orange block under the,
Yes, my
under the.
favorite slides, yeah. If you go to, I'm gonna pull this up myself.
But I couldn't find it, and you were talking about nurse family partnership, but I didn't find it under
Yeah,
there.
it's, part of it is that difference in how we describe these programs. Thank you. So if you go to the community wellness section.
Yes.
On the far right side, there's a public health program manager.
Yeah, oh,
I know,
MCH program manager.
Yep, there's three managers on that chart, there should be.
okay.
And the third one, their public health, that was Chris Hawkins previously, so a lot of our prevention work. And then underneath that team, is where that position sits. Is that, can you see that on yours?
The admin assistant. What?
They're not.
Oh, they'd have to zoom in. Far right.
Far right.
Yep.
Oh, I see, over
Okay, the
here.
public health program manager?
One of these educational and
That is-
outreach specialists.
Yeah, so this group right here is what we're sort of unofficially calling our prevention team. And like I said, for those who've been here for a while, Chris Hawkins was the previous person in that manager role. And then that's where that position I think is, it's, yep.
Can we
you know,
call
in
it
there.
public health prevention program manager? I don't know, public health program manager is kind of vague.
Well, I'm smiling because we're kind of in the middle of trying to figure out with Chris leaving, we're trying to figure out how to work that program a little differently. I think prevention is the word that would be in there.
Yeah,
Going
yeah, well,
forward.
whatever, but a better title
Yep.
would be good.
Yeah, and and here you're looking at classifications. You're not even looking at our working titles, which is not as, it's harder for me too. Like I literally am looking at Jen and Corinne because I'm not tracking our working titles versus these classifications. But that's where that person lives, in the prevention team.
So Commissioner Edwards, I have the answer to your question. So
Yeah.
14% of our total budget is allocated to public health and social services.
Of the total county
Total
budget,
Total
the
county
400
budget.
million or whatever.
Is that including what we've had in the budget from the COVID money?
Yes, so everything, 2023's current budget, they
Okay,
are
what,
14% of
what's
it.
it gonna be minus the COVID money? That's my real question.
Okay, I'll
Of
take out
our
ARPA.
everyday activities in the Board of Health.
We'd have to pull all the COVID money that public health has received out.
I'm curious as a percentage, I mean, maybe it's 23%, I don't know, 25%, but my question then is gonna be, are we charging the Board of County Commissioners position to the board, to the Health Department, Foundational Public Health? I'm trying to figure out every way that I can figure out to take pressure off the current expense budget.
Okay, so I can answer, for Nicole to say, what is it without COVID? That becomes quite complicated.
Okay, I don't need to have that exact,
Right,
I'm just,
we
but I want you to
certainly
know
look
where I'm coming
pre-COVID.
from.
But as far as cost allocation, all of the things that are allocated out on that 60-40 split
Is already done on
is
in that regard,
absolutely going toward public health funding sources.
except for that million, what, 2 or whatever it was.
Except for the million sum, yes, that goes
And
directly
I
into
really
public
don't
health.
understand why that is, to be honest with you, that.
We're gonna get that information for you, Corinne is working on
But I
it.
will tell you, and you can jump in, Robin, of course, sort of every county in the state is expected to have some minimal amount of contribution to their public health department. And it usually is tied to like state mandated services. And so the money, traditionally that money that you've been sending to the public health department is attached to things that like have to be done. Now the
Well,
state
that-
doesn't give you.
The way it used to be, maybe is
Under
gonna
this.
change. That's where I'm coming from. I'm gonna work on changing all of that, cause all the counties are faced with this same revenue shortfall that we're faced with. It's not gonna affect you folks that much, but when we're done, just because it's the way we used to do it, or maybe that's what they take, doesn't mean that we're not gonna look at,
Oh, sure.
reviewing to see, okay, can we take this pot out? Why is it really there? Well, it's always been there. That's not a good enough reason for me, but maybe we'll ask for a legal opinion from our prosecutor. Is it a must? Cause what we're working through here is what we'd like to do and what we must do, and what we have to do.
So I will tell you that there is an RCW, it's RCW 70-05-130, that states all expenses incurred by the state, health district, or county in carrying out the provisions of chapters 70.05 and 70.45, that's all about public health, or any other public health law, or the rules of the Department of Health enacted under such laws, shall be paid by the county, and such expenses shall constitute a claim against the general fund as provided.
Well,
So.
I'm not questioning that,
The law clearly says that the county will pay from the general fund.
but I'm still
we
gonna try
have
and
all-
squeeze that down.
We are working very hard to squeeze it down, and we have, but I am regularly asked, why aren't you paying this out of general fund like the law says? It's because we have been extremely successful in getting grants and other funding from
We don't wanna
the
jeopardize
state.
that.
That's right, but we have to put in some general fund money.
But maybe half of what we're doing today.
Maybe,
I
so
don't know.
Corinne's
That's-
doing a review, and like I
Okay.
said, there's a maintenance
There's a
effort
lot on the
in
line.
NFP, there's grants that are required match. There's a lot of reasons we put in general fund money.
A great example is per RCW, counties are responsible for funding the tuberculosis response. And that is outside of foundational public health. That is a county obligation. So depending on what active outbreaks are occurring and how those are being managed, it can be quite expensive. And so I think it's.
All the more reason to discourage everybody from the United States coming here and taking up some campground situation, because we let them do all the dope they want. We let them live any deviant lifestyle they want. We furnish them all the food they want. We furnish them rooms and whatnot. And more than half of those people are from elsewhere. And so we're just inviting trouble every time we don't address every issue as tight as we can. So,
As a person from elsewhere, I promise you I did not get any,
I bet you did
any
not.
free anything.
No. No. I am sure you did not.
Okay.
Okay.
Let's move to priority 3.
Yep.
Are we done with, did you?
Yeah,
do-
that was it. It's a small item. It really was a couple of positions that we're trying to make.
It's just a reclassification.
Yep. Okay, so this one is significant for many reasons, but this request is really us trying to authorize the work that the COVID team's been doing for the last couple of years. Those staff are all temporary, they're project positions. And what we've seen is that those positions have been incredibly valuable for us beyond just COVID. They've assisted us in a variety of non-COVID outbreaks, surveillance, outreach, and other work. One of the themes you're gonna see from counties across the state, I'd say we're a little behind other counties on this one, was a lot of counties went ahead and when the COVID response started ramping down, they absorbed, some are part of that COVID team into their larger communicable disease program, because they recognized that like the work wasn't done, right? This wasn't just we needed people to do something for this 2-year period and we're good to go. A lot of counties, including Thurston, have really struggled to have the sort of staff support for outbreak and surveillance. And so I think at one point at the highest peak for COVID, you all had, I think, something like 120 additional staff that were working specific to COVID. Today, we're down to about 15 folks. This request is looking at almost half of that in terms of work that we think is core to the department moving forward. So we've got folks who will help us on outbreak surveillance, folks who are helping us with immunization outreach. We've got folks who are helping us in the community health space, community health worker space, and we've got some epidemiologists as well. So that's kind of the core group that we're looking at moving forward. So for me, these are new positions, but they're positions we've had for a while. We're making them permanent. The funding stream for this is funding from the state. So we're not asking for the county to contribute to this. This is again coming from a combination of foundational public health and then communicable disease funding from the state through the feds. So that's what that category is there. Yes,
Questions on this one
go for
before?
it.
Okay. No one else has questions?
No.
Okay.
I'm listening to your question. Might generate a new
So we
one.
might
You're
generate
the star of the show. Here we go.
So I guess I'm just wanting a little bit more explanation,
Sure.
right? Because I'm seeing your list of requests, which this is such a great chart. You know, I'm seeing around 11 new FTEs just for disease control and prevention, knowing that a lot of these positions are kind of like COVID and trying again to establish that foundation.
About half of them, yeah.
But kind of, I guess I would like a little bit more of an explanation on like, as we're supposedly transitioning out of this COVID era, right? And just kind of like, what is it specifically? Is it gonna be, and knowing that there are, of course, a million other diseases. But if you could explain, right, just for the public on a little bit more on what these positions are for, what level of service it is that we're giving to the community with these positions.
Can I make a quick comment on
Yeah,
that?
go ahead.
Because my comment was gonna it was gonna go on the backside of what
Oh,
you said.
okay.
Which is just that, I don't know if these are the right positions, but I'm super excited to see this, cause way before COVID, when I joined the board, one of the first things that there was a lot of things going on in public health that I was confronted about and engaged with staff. And the number one red flag that I saw was just a criminally underfunded and incapacitated disease control.
Yes.
And then this is again before COVID, and we scratched out enough money for one extra, and I was really proud of that, like, oh, look, we've added a
Which we're
we've
grateful,
added a
which
thing,
we're
like,
still
I really
grateful
helped
for, by
solve
the
a
way. It's
problem,
been
but
really helpful.
this
Yeah.
is like building a foundation that I was told by the experts that we had at the time. I think there were only 3 at the time, but I think I met with all of them, and I
Yep.
think they've all retired or moved on, but in any case, it was pretty clear to me that we needed this kind of revamp to this group, and we didn't have the money for it. So this is the thing I'm most excited about, frankly. I mean, of course, I love environmental health, resources as well, but this is really exciting because, the position we were in when I came into the board, this was dreamland to think that we were gonna add, this many employees to this super under-resourced group. So, I guess piggybacking on Commissioner Mejia's, that's the foundation. I come in with very excited and open ears. Now I'd like to hear why these are the right positions to give the group its foundation that it needs. How
Yeah,
does this plug in the gaps?
It's one of those things where all of us, I think, know the severity of COVID and there was incredibly negative impacts. But there was a flip side of COVID, which was really opening the door to federal funding and state funding to areas that have been criminally underfunded for years. And so for us, we're trying to take advantage of the fact that we've got these new funding streams in place to actually do this. Like, to your point, Commissioner, never in a million years could I have imagined asking for 5, 6, 7 positions upfront like that. There's not funding at a county level for that kind of work. This would have been something we would have basically had to do over like a 10 to 20 year period, right, of adding 1 or 2 at a time. And so for us to be able to have ready-made sort of positions that we know what kind of work they've been doing, we know we have the fund source for it, it is incredible. And so I want to echo that to say I'm really grateful for that. If we were starting from scratch, I would definitely, there's other positions I would want, to be honest with you, but like this is down to our kind of core functions. And so when you're looking at what these folks would do, it's a range of work. One of the biggest things I will mention is outbreak surveillance and management is the biggest thing. So there are a whole host of conditions, diseases, or communicable diseases that are known as notifiable conditions, where if it shows up in your county, whether it's in a school or at a place of work or in a long-term care facility, it has to be reported to the health department. We have to investigate it, we have to provide guidance and assistance, and that list is a long list. And to Commissioner Minter's point, if you remove those yellow boxes from your chart, remove all of the yellow boxes, remove the orange box at the community health nurse supervisor level, and remove the yellow epidemiologist box, you had about 5 or 6 positions, a few nurses, a few sort of administrative folks, a few EPIs or disease investigators that were the source of all the outbreak management, containment, surveillance. It was right there. That was it. That's all you had. If you had multiple outbreaks, multiple serious issues, you were stuck. So what the county would have to do when things got really tough was to go to the state when things were overwhelming. And I think I alluded to this at the Board of Health meeting. We're at a place now where the state is saying, hey, we've provided enough funding streams for local jurisdictions that we need you to actually start building your own capacity as a county to fight these things or to monitor and to assess these things. If you keep coming to us, and this wasn't done they weren't trying to be negative, but we're gonna basically charge you for our staff time to do the work that you could be doing with this funding we've given you. And so part of my ask here is to say, hey, like, if we don't use these positions, not only are we sending money back to the state, we're also gonna be still paying money to the state to do this work when we do have outbreaks or other conditions that we can't handle.
What I'm specifically curious about is looking at your yellow and orange boxes, you have 7 outreach and education and 2 epidemiologists. Why is that the right?
Yeah, and
ratio?
again, the working titles are I don't love the working titles. I would describe their work a little bit more
Okay.
in depth. So I'm gonna start with the middle, the social service specialists. These are really our community health workers. These are our quarantine, oh my gosh, our INQ facilities. These are folks that are out in the community helping support. So when we have a COVID outbreak at a homeless shelter, these are the folks that are out there helping to sort of meet needs, connect them to resources, support them with temporary housing when we have problems. That's what that group right there does. That could be any condition, not just COVID. They happen to be doing COVID right now because that's the funding source. The E&O specialist, if you're looking at that group right there, the middle section, I hate like pointing at something you can't see. Oh, thank you. That's so much helpful.
Thank you.
So there's an E&O 2 specialist with 2 other E&Os below them. It's gonna be our future IMS team, our future immunization team. Right now, there's one person we've got that's permanent, that's our immunization coordinator. Sorry, go ahead.
Oh, no, finish your statement.
Oh, I was just gonna say, this team is really focused on immunization and immunization outreach coordination, helping us set up clinics. That's what that group right there does.
So the names are a
The
little,
names are a little bit wonky, like.
like, I would give these different names.
So
that
these
the
are
community-
just what the
Titles,
county,
if
sorry.
they're the
Classification.
classification titles that HR recognizes, and then within them, what David's talking about are working titles. It's like Jennifer is a senior management analyst, but on a day-to-day basis, she's a budget analyst. She works on budgets. So these are just the class titles that the county has that this works fits within.
So this has driven me crazy since I've been here, to be honest. Like up a wall crazy. What I think I might do, if it's okay with y'all, is for follow-up, is I can put on the working titles for this. The working titles are they're not official, they're not recognized by HR. This is just when
Well,
you,
it helps us know what they're doing.
Yeah,
Like, I wanna know what they're doing.
yeah,
Yeah.
so.
You know, I don't care what classification HR
I
gives
know,
them.
so we pulled,
That's not-
again, we
that's
pulled
not my-
from the system, this is what they show up as.
Yeah.
But I'm happy we can do a version of this with the working title.
Yeah, cause I'm seeing education and
I know,
outreach and
and-
I'm just like, wait, like why?
Yeah,
Why
no,
are they
don't let
here
that be
and-
that's the back end classification, but the work they're doing, like I said, you're gonna look at, these are immunization coordinators, that's what that group does right there. And so that's good feedback and it'll help me too, cause this drives me nuts. I literally have a version for this where I've asked for the names of people, just so I can go, okay, I know that Wendy does X, cause this isn't helpful, so I share that with you.
Okay, well then I think that helps me a lot.
Yeah, so, yes, and then the other side, you've got folks who are really working on being out in the community and helping us with screening, helping us with surveillance work, going out to facilities and providing guidance when there's an outbreak. These are folks that are the front line when schools have problems. They're calling this group right here. They're working right now. This is who is working with our school superintendents, with our long-term care facilities. They're also helping to do work with, not just with COVID, but like I said, they're doing kind of work beyond COVID at this point. We're seeing respiratory illness go up, so they're getting questions from that end too. And then obviously the epidemiologists, which is the other group here, are the folks that are really gonna build our capacity to do that data analysis, that assessment work, that being able to look and see trends, like that's what what those positions are intended to do, if that makes sense. And then I'm not skipping, but the next priority area is still within this budget, so we'll just keep this up. We're looking at a reclassification of a couple positions. And these are, so in the, I keep like pointing, I need a laser pointer.
Do you wanna use the mouse to highlight the
Yeah, that'd be
positions?
great, thank you.
You wanna do that?
Just dated myself talking about a laser pointer.
I know.
I don't know.
Okay, so this group right here is really a group that is focused on a lot of our drug user health. So a lot of our opioid work is in this section right here. And so we've got three different requests in this one, two of which aren't really fiscally related, so the orange boxes are reclasses. Right now, that program manager is actually a social service specialist too. This is Katie Strozik, who runs our opioid task force. The reclass is to acknowledge that we've far outpaced the work that she was supposed to do years ago. Though the need in the community, the need at the county level is that we need to have someone at a program manager level who can really work through these issues. That's what the reclass is. The yellow box is a new position. This is one of those FPHS positions I talked about. This is for that parenting substance abuse coordinator. We wanted them to fit within this team. It made sense. And then that orange box right there is another reclass. We have a position that we've been basically scrapping by. They're half-time, but we've been temporarily having them work full-time. We're trying to get them up to full-time work.
Can I ask, so
Yeah.
in the first reclass, this is priority 4,
Yep.
and why was it, I'm looking to the budget team, why does it say $230,000 the first year and then 23? Why would a reclass cost $230,000?
The other
Yeah, where's,
PowerPoint, it's 29.
29,000 probably,
I
or,
might have gotten excited about that one.
okay, just making sure.
I was like, that's not accurate.
Yeah, that
at
couldn't
all.
be possible.
These are minimal costs for every classes, so that's not a,
So 29,000 is or 22,900 is the right number.
yes.
Yeah.
Good catch, thank you for that.
About 29.
22,929.
That's what I've got in mind. I hope we don't have 3 different numbers floating around.
No, thank you. Okay, so let's keep going to the next. Oh, I guess I have this. Yikes.
So I have it. So are you talking about next
Can you go to the next priority slide? Yeah,
priority slide?
yeah, thank
Okay.
you.
Let's see, this is
5 and
not a
6.
slide, so
Number 11.
I'm sorry, give me a second. They're not in one presentation, so I have to find it.
Sorry,
It's all right.
making things difficult for you.
I will get it up.
No,
there.
I think that breakdown was helpful because
Yeah,
So-
when you read this, it doesn't tell you the picture of what they're actually doing. I completely agree.
Yeah, like I wouldn't even know that whole branch is related to substance use.
Yeah, so I'm more than happy for us to come back and have a version where we really look at the more descriptive way to look at this.
Here we go.
It's okay, thank you.
My mouse. That doesn't control anything
Okay,
up there.
good, a second. Okay, so we're gonna move to another page, right? So we went from the disease control prevention group, now we're moving over to the community wellness group. So this is where the bulk of the staff here are our nurses.
So I think I could do that quickly for you.
Thank you. I
We'll
appreciate
figure
that.
out where community wellness is.
Yours was disease and
There
prevention.
you go.
This is the one, the NFP one where I've been.
Everyone's got their favorites.
So
I like
this
them
is
all
only-
equally.
You can't have
You
a
have no
favorite
favorite
now.
children. That's right, exactly. Okay, so this is our nurse family partnership. If I can actually pull the right one, that'd be great. So these requests are being asked for out of a combination of funds, but primarily treatment sales tax. So this is the TST funding that we're looking for.
Okay, wait a minute now, you're asking for this out of treatment sales tax,
Correct.
and it's 800,000?
Nope. Priority 5, the first one.
64,000?
No, keep going up to the first priority number 5,
Oh, we're on 5, not 6.
283.
147.
Says 283 in the second year.
They phased some stuff in,
Correct.
so that they, David can talk about
147?
this. They
Yes.
knew that there was not the need to hire everybody January first. They
Well, this
phased
is
them into the
multiple
second year.
positions.
Yeah.
Yes. Yes.
And the reason I'm asking about that is treatment sales tax is down a bunch, so I don't know if we have the capacity.
You're gonna hear about that this afternoon. This afternoon, David said.
You will. So again, we make these requests sort of independent, like, we just put out requests, and the TST advisory committee makes the initial recommendation of what they wanna fund or not fund, and then obviously you all make the final decision.
And if treatment sales tax didn't have enough, is there another non-general fund that is
So-
eligible
So
to take care of this?
To be clear, with our nurses, not really. This is why we went this route, because there isn't. So I will tell you
Can't
specifically,
Stretch,
FPHS is not an eligible fund source for our nurses to do services. That is not included in there.
Can you disclose to us, as I think pretrial services did, whether or not your TST requests were part of the recommendation from the advisory committee?
Yeah, so it was, I would say it was a mixed bag. So we got some of the requests, not part of it. if
And
that
can you
makes
tell
sense.
us which ones?
Yeah, so we,
The two.
yeah. So on that chart,
Well, I see like on our cheat sheet, I see
Yep.
4 that are
Yep.
TST related.
yes, so we had.
These 5, 9, 10, 17.
Yeah, so for us, we were looking at a combination of more on the ground support, so 2 additional nurses. And then we were also looking at a nurse supervisor to support that. There's basically a formula in place. When you add nurses, you need to add a supervisor. These are state and national requirements. We were also looking at better supporting the leadership capacity within that division. I think I said this to the Board of Health. This chart is really telling to me that when you remove the yellow boxes on this one, you've got a division director who's responsible for everything else there. And so the request was part increasing our boots on the ground, part management. And so what the TSD committee did was they gave us basically half of what we asked for. They gave us some of the management and administrative support, but not funding for the nurses, which,
Recommended.
yes. So we got, thank you, so we got some management level support from them. We got a community health worker, but we did not get the 2 nurses as part of the recommendation.
And the 2 nurses are which request? Can you tie it to
It's
your-
in a later, it's in a later request. It's in another priority 7 is where that lives.
So number 7, you didn't get recommended for that
Yeah,
one.
so basically we got all of priority 5 and
All of
part,
priority 5.
which is the 2 FTEs there, and then part of priority 7.
I'd just like to add, when we go through the TST presentation, each request next to it says if they were recommended or not, and how much of the position was recommended. So after this
Even the ones
presentation,
that were not recommended.
yes, it's
You'll be able
listed
to,
there,
you'll see
or,
it laid out.
or a portion of it was approved, it'll say how much was approved.
Well, it's useful to hear it here too.
Sure.
But I don't know, right? Like I do this in a vacuum of, this is what we requested, and then my part of the process kind of,
Yeah.
I step out of that,
I
right?
got it.
So this is just what I requested, but yes, based on what I saw later, it appears that they recommended essentially half of our request. So again, priority 5, if you're looking at our capacity on the kind of leadership management side, which I'm super excited that the committee recommended that to move forward. It's been a long time coming to have leadership in that area, additional leadership in that area. Priority number 6, and again, the way that this is structured is, I know is confusing. So ignore the dollar amounts for a minute and focus on the fact that what we're doing is supporting part of an FTE. So this request ties back in with our new FPHS funding. This is related to an MCH program manager. So this is part two of that request. We're looking at using some funds from DCYF to support that. That $800,000 number you're seeing is a recognition of the full grant we get. And we are including that as part of the process. It's just a confusing way to see it.
Is it enough to cover this?
Yeah, so this is enough to cover the needs of both this position, and then it's funding our some of our nurses and the work they're doing in home visiting. So yes, it's good. We always need more, want more, but this is actually a little bit more than what we'd gotten in the previous year. And I think Gretchen maybe mentioned this in a previous Board of Commissioner meeting.
Can it go towards this number 5 priority?
No, we, again, this is where it just, when you have these obligated fundings, it's all about the specific kinds of work that they're doing, if that makes sense.
So, but you said it was gonna help and pay for this leadership. What's it paying for?
Yeah, so this is where it gets a little complicated. So you've got a couple of different sides of the house we're working on. We've got folks who are out in the community doing our nurse family work there, and then there's other maternal child health work that we're doing that isn't just related to home visitation. And so we've got kind of a couple of different buckets in that category. For those nurses, a lot of that funding is coming from DCYF and from the TST funding. You're looking at that, that's what that bucket is. For a leadership level, we have to find other sources to support more administrative functions. So TST is an eligible funding source there.
TST again?
I'm just repeating what I said earlier. He was asking about the leadership positions, and I was saying it's,
Well, I'm sorry, what I'm asking about is policy priority 6. It says contract increase, and then it says half an FTE.
Mhm.
And so you control that contract, or we just happen to get some more money in the contract?
oh, sorry, I misunderstood your
And
question.
then what
Yeah,
FTE
it's-
is that supporting?
Yeah, so the Department of Children, Youth and Families increased their contract to us. It's a contract we get every
Meaning
single year.
kind of like a bigger grant sort of thing?
Correct. Correct.
And
So
then you're gonna put that to who?
it'll go towards supporting our nurses, our home visiting work. And then some that we're gonna use towards helping support having a manager on that program.
The MCH program manager?
Yes. It's just the way that it's laid out in this slide is harder to sort of see again of like new money coming in and part of it's going here, part of it's going on.
Cause when we see contract increase, we would just be like, that's like kind of like maintenance level, we gotta pay more for something we're already paying, cause the contract amount went
Yeah,
up.
no, it's revenue increasing.
Really the opposite, and
Yes.
then you've got some flexibility with
Correct.
how it's
It's a
applied.
positive for the county on
And I
that end.
think Gretchen already discussed this with you. It was I think it's already executed, isn't it?
Yeah, the board approved this last week.
Yeah. The DCY increase.
Yep. But thank you for the question. Again, it's the way it's worded, the way it's sort of written is it's harder to see as it's a positive revenue for us. Okay, we can go to priority 7, which we actually already talked about, but this is the other part of the TST request. This is a medical social worker, a community health worker, nurse, this is all in that category. And this is where the committee recommended some, but not all
Like
of this
one or
request.
out of
One.
3?
One of this.
Okay.
I guess I'll throw in my pitch here, because this is this is where I have my bias. And the level of the acuity of cases that are coming now through NFP are pretty severe. I mean, we are seeing younger parents.
Yep.
We're seeing, a lot of mental health. We're seeing a lot of substance abuse. And it is pretty, we got a letter from Providence from from the hospital letting us know, like, they're trying to refer people, but their, nurse family partnership, it's full. And they have that ongoing wait list. And sometimes by the time they're able to reach those parents, it's a little too late. And, we talk a lot about prevention. And to me, this is a big part of prevention. We're helping those parents, help be good parents and, get those children in good situations. And the work that those nurses do out there is really amazing. And I can really see how these positions would help assist in really strengthening that program. I know, again, I have a very soft spot for this program, just because I've worked with Gretchen in different occasions, but I just, from the stories we keep hearing in the community, I just do not see how does not fit in with treatment sales tax. And I did reach out to a couple of the members, right? And I kind of wanted to hear their thought process and explain to them the need. And they just, what I gathered from them was they just didn't understand what the need was. They didn't understand kind of what was happening in the community. And they also thought that there were other grants or other ways to fund these positions. And after I let them know, it's like, no, right now a lot of this work is already grant funded, and the money that is coming through is not enough to really cover everything that they're doing and the need in our community. And I know I'm gonna really be pushing hard for this just because the need is really there. And we received a letter from I think it was South Sound Pediatricians as well in support of this request, just because they're seeing that impact as well.
Yep. Well, and I think this is, and we can move from this, but I want to just really quickly, to your point, Commissioner, in that priority 7, those FTEs, I want to just note really quickly, so, there's a nurse in there, but there's also a medical social worker and a community health worker in there, in that priority 7. This is a TST request on our end. And so, yes, we have a backlog, we need more nurses, we need supervisors, but this request also really gets to the heart of what Commissioner Mejia was noting, which was we're seeing harder cases, we're seeing tougher cases. So the medical social worker, if we were able to get this position, this is someone who has experience, has certification on working with mental health needs. Folks who have suicidal ideation, for example, we've got folks who can handle that. The community health worker, I'm really excited about the community health worker because for us, we would be looking for a bilingual community health worker. So as we're getting referrals, this is someone who can also support our Spanish-speaking population as well. Okay, priority number 8, we've actually already referenced. This was actually that reclassification of the opioid program manager. That's where this is sitting. So we can move to the next slide.
Priority 7 is funded again where?
TST.
And new from TST.
So we're gonna, okay, just real quick before we move on, when we see TST, we don't have a list for TST, so we need to go back to all the different departments and
I
mark the sheet.
have another list of TST that I can provide to you for deliberations if that would help.
Well, when we go back, I can't really, Commissioner
I can
Mejia makes
provide
a
it to you
great
before
argument, but I can't
deliberation.
really know until I hear what all the TST revenue is and what all
Yeah.
the requests are, so how am I, and there's been TST requests scattered through the different presentations, so.
Just say yes.
That's a good method, just smile and nod.
You may not have a specific spreadsheet in front of you today, but you will see the recommendations from the TST subcommittee in this packet this
Are
afternoon.
they aware of what's going on with TST? Yeah, but I mean, as far as the funding,
Absolutely,
They're painfully aware.
Shaylin worked very closely with our team to develop the financial plan.
So you're getting kind of a preview, so you're gonna see Shaylin in about 45 minutes, and you'll get the same thing.
I do.
And I need to be able to mark those and.
Okay, so I wanna backtrack a little bit, because I got too carried away. I've grouped a bunch of stuff together. It's still TST, but priority 7 has, it's got nurses and it's got some program support. So we're looking at administrative support for the division. Our next slide is where I can spell out the social worker and the health worker. So the first one has nurses and program support. 9 and 10 have the social worker and the community health worker. So I jumped the gun, sorry guys. get to the next slide, because we had talked about it. Okay, so we're moving over to our administrative services section. If you wanna pull that org chart for a second, up again, I can just show it.
Administrative services. Are we at the end of the presentation or
The beginning.
the beginning?
So 7, 9, and 10 are all, you were all speaking of them together?
Yes, and
So for example, maybe the TST committee supported 7 but not 9 and 10, or.
yeah, they
or
supported
some-
like 9 but not 10, and I don't have their presentation in front of me, but
And
yes.
then you skipped over 8, if we're gonna talk about.
So 8 we actually covered, that's the opioid program manager, that's the
Oh.
reclass.
No, but the opioid
Oh.
reclass was number
Go
4.
back.
We talked about the 22,000.
Dollar amount isn't so much to spend too much.
This one's only
time on.
6,000.
Yeah, no, so one of those was, so there's 2 requests in DCP, and I talked about them in kind of a bundle.
Okay.
One of them was to move someone from basically a part-time FTE to a full-time FTE in that section of drug user health. The other was to reclass Katie's position
These
into a.
positions only the 6,000 one?
Yeah, it's not a huge change in terms
The
of
other one's the
difference.
bigger one,
Because you're
it's
going from
half-time.
part-time to full-time. That's why
Gotcha.
you're seeing that number bigger, yes. Thank you. And when we give you the working title version, it'll be more clear too, again. All right, going back to priority 11. Okay, so administrative services. Sort of similar to the county, this is our version of basically essential services. So we've got our HR functions are living here, our vital records office lives here, so all of our birth and death records go through here. We also have our emergency preparedness and response team. Our PIO is also in this group as well. The request that we were making here was on the sort of HR administrative side, looking at adding an office assistant to our team. We have a department that is incredibly complex and large, with a lot of moving pieces. You all know that we've struggled over the years to try to get ourselves up to speed when it comes to hiring and onboarding and managing sort of our internal HR capacity. And so this is an opportunity for us to really grow that capacity and have a team that can really move quickly and effectively with our issues there. Priority number 12 is, and I will actually let Corinne talk about this one. Priority 12 doesn't involve new positions for us, but I wanna maybe, Corinne, if you could talk a little bit about that MOU with Public Works.
We have had our public defense, sorry, I went way back. Public health and Public Works has had an MOU for years and years and years for, our side of the fence is supporting the regulatory, I guess, mandates from the state for the work for solid and hazardous waste.
Correct.
And so I think it was about 2 years of work between Art and Patrick Soderberg to get a level of service for what that cost is, does that mean? How does that work? So what we did is they worked with Public Works to create an MOU that detailed out what that actual need is, and what that need is FTEs. So that was finally done in August.
Yep, I signed
So
it.
what this request is it's a direct allocation for our staff that does this work that's needed, mandated for the regulatory work to be over in Public Works Fund doing our work, when we're offsetting the costs with our grants, our state grants that we receive that also supports that same work. It's kind of a long,
Yeah,
confusing way of
but-
describing it.
but basically, yeah, we've got funding.
Clear as mud.
We've got funding through Public Works, do their tipping fees. A lot of the work that we're doing is really on education and outreach, something we've been good at historically for years. It's a really strong partnership we've had with Public Works for quite some time on this one. What you're seeing here is a recognition of that MOU in our budget process. You're seeing the money coming in from Public Works. It's not like brand new work that's never been done before. It's recognizing that MOU coming in.
Shouldn't we just look to our budget staff
This
to
is-
tell us if this is good?
This is really a technical decision, but it's a policy decision because it's shifting the funding from one department to the other. The work has already been done in public health. And Robin touched base about why we wanna do direct appropriations, because all of the paperwork for billing, it alleviates that, so.
Sounds like an accounting question.
It's that thing where you say yes, you just nod and say yes. This is one of those.
But they're not asking for new money, they're not asking to do new things,
Okay.
it's just
The work's
which
been done.
department it sits in.
But couldn't we save some money there and divert it to the general fund? That's always my question.
Commissioner, I'm seeing a theme with your line of questions.
I'm wondering if David and Jennifer Walker have a little bet going of who can confuse the commissioners with the budget complexity.
I hope she's
to the
winning.
greatest level.
Um,
I thought she had it hands down, but you're like,
I know,
you're
listen,
closing that
it's-
gap, baby.
That's why I wanted to just say yes, it's fine, it's good. Okay, so our next slide.
That's a substantial, just say yes.
It's already in the budget, it's just budgeting
Exactly.
Public Works, they wanna move it to their
Yeah,
department.
that's fine. But I'm always looking to try and save something out of it. So it's just the way it is.
Okay, priority 13, this is the first time that our housing office gets on the scene. They're looking at a new FTE related to rent assistance. I'm really excited about this position. So we know that COVID had really exposed sort of the struggles that folks have had on the rental side. The Department of Commerce is developing a new permanent rent assistance program, so beyond COVID. We actually don't have staff right now that can oversee that work, so this would be a person who would help work with that. But it also is a person that can really help us at the Regional Housing Council. This is someone who can help us from a policy perspective as well. I know this is an area that the council has looked at for quite some time. And I'm excited about having some more capacity on the housing team for this one.
What fund?
Which one is this one?
Housing.
Housing.
When you say housing,
You know what specific?
home fund, the,
Oh, this would be paid for out of, I believe is it admin for, look.
It's from I think it's from the local home fund, isn't it?
so home fund's gonna get hit too on this sales tax. It's gonna be less this time around.
But
Well, recordings are down.
yes, exactly. This is the area though where when the recording fees went down, the state of Washington stepped in and backfilled them with state money
Yes.
specifically for housing.
Yep.
Not for any other thing that we use recording fees for, but for housing, they backfilled.
This is another area that's
Near and dear.
near and dear to me, just because of the work they do. They did a survey recently, and David, I'm looking at you to see if you have those stats, but the survey was in relation to the rent assistance to the close to $55 million that we gave out to the community. And they did a survey to the community, and the respondents, it came back that, and I'm trying to think of those percentages, but I'm not sure if,
I'm phoning a friend in the background to Tom about this one, so if he pops up, I'll let you know.
like, I'm sure I have the stats, but I mean, it was just, I kind of see you right, because the need in the community is still there. The results that came back pretty much were a high percentage of them were still struggling.
Yes.
They had gotten behind again, and
Yes.
they were, about to lose their living situation, and so,
Yeah, we had it at 50% of the respondents.
Yeah.
Said that they still were struggling, so yeah,
And
half.
so the number is still very high, and so having kind of that capacity with someone who's able to kind of assist us in that, and as the Regional Housing Council moves more into that long-term strategic planning, I think this will be just another good asset to have.
Yeah, no, I'm really excited about the possibility of having a point of contact, right, for tenants to go to when they're struggling and need to know where to get resources. Oh, yeah, and you're gonna get a briefing, I think, in early November on the survey, so.
Perfect.
More to come. Okay, priority 14, is a placeholder. And this is one where, again, Corinne and Robin and Jennifer all are well aware of, which was the opioid settlement fund. We created a new fund that the board approved about 3 months ago, maybe. And we've been receiving, allotments, through the settlement over the last almost a year now, to do this. This is, again, a placeholder for the fund itself. One of the things I'm really excited about in my role is getting to work with the county on our opioid task force and looking at going from making plans to actually spending these dollars on projects and ideas. This item right here doesn't spend any of the money, it's just recognizing the revenue coming in. And then we're gonna create a regional council that will really help us with an RFP process, kind of like the Regional Housing Council, where providers and others can come in with ideas of how to best utilize that funding. Commissioner? Oh, sorry, I saw your hand.
God, sorry. One of the hazards of having an open walkway and stuff here. I'm kind of a friendly guy.
Beauty pageant.
We're a very relaxed setting.
All right, we'll go to our next slide then. These are, again, these are technical things now. So we've got from our policy decision making to more of our technical pieces.
Hey, before we go into that, maybe
Yep.
it means I interrupted you and stuff, how about if I get to ask you a question?
Go for it, go for it.
How much time, like on this opioid thing, how much time do you guys spend over at the jail or over at the juvenile center?
A lot. I feel like I joke about Katie spending more of her time behind bars than any other position I have. We spend a lot of time working with correctional facilities, law enforcement, schools.
Juvenile and adult?
Correct, both.
And are we billing some of that activity to a fund like this?
So if it fit the sort of allowed categories, we could. I know one of the categories for the opioid settlement fund involves Narcan. And so, you know, there's definitely potential there. But I would tell you, this would be an open process, so the department would be one of a number of entities that could access this funding. We would have to go before this council like anybody else to propose using that money. It's not a fund source that's coming to us that we can just use, if that makes sense. Like with FHS, it's coming to us, we can allocate it. This one, we're really trying to use it at a community level, and again, we could have proposals and ideas as a department, but so could other nonprofits as well for how to spend that money.
Okay.
And hopefully they're all based in the opioid response plan.
Correct.
They would have to be.
Yes, and the way that we were framing this would be that the work fits within the proposed priorities and ideas within the response plan the county's had for the last couple of years.
And the board has signed an interlocal agreement with the cities to form a
Yeah.
opioid abatement
Yes.
council, which is required by the settlement, but we're going to pool our resources to get the best results as a region.
And so David did say that this doesn't give spending authority. It does give the spending authority. Part of the reason for putting it in now is so they didn't have to wait until May when we did our Amendment 1 process
Yes.
to spend the money. So the council can come up with plans, they can go through the process, and they do have the availability to start projects in February instead of waiting until May or June to get
Yeah,
started.
that's a good clarification. I guess what I should have been more clear about was we're making the choice as a county to use this process versus the department taking all the funds and spending it sort of internally. We're looking at a broader process, but yeah, we have the authorization to use it. The next couple, I'm gonna go really quickly because they're not policy decisions. We have a couple of end dates. Either they were inadvertent end dates or ones where we realized we had more sustainable funding. And so that's what these two slides are. They're positions within community wellness and EH. where we are, we know we have the funding, we know we have the work, and we wanna make sure that these folks can continue to do their jobs
What are
moving
these,
forward.
like peer counselors or?
So the first one, yeah, it's a prevention specialist, so these are someone who work in our prevention area and the community health work area. This is a broad level of categories. We have a pretty small
Like,
prevention team.
Like get a certificate from the Department of Health and go through some training?
Yes, you could, ideally, yes, that's what we'd wanna see for that position. The other one is a administrative assistant, over in the EH, division. Next slide.
Oh, never mind, keep going.
Next slide, looking at another reclassification, this is for the TSD program manager. When I came in, one of the things I wanted to look at was, are we actually working our folks within class? Are we working our folks within how they should be working? And when I look at some of our managers and our sort of mid-level leaders, we've been asking a lot out of them over the years. I believe that the complexity of the TST program, the scope of work it has done is actually more appropriate as a senior program manager than as a program manager. And this is a request that also was in the TST budget process. And the committee did not recommend that funding to be used. So, and I wanna be clear here, the committee doesn't have the authority to recommend a reclass or not, but what they can do is recommend the funding that goes towards that reclass. So I'm just gonna put that out there. Priority 18 is another FTE that we have been scraping by at half-time and looking to move to full-time in our housing program. Next slide.
And from where, the money from where?
So this one, let me pull that really quick.
How come?
Fund 1400 is, okay, how pays for the housing.
Housing,
programs.
okay, some of these, you know, it says right in there where it's coming from.
Yep.
Others it doesn't, it just, you know, it'd be simple if it did, but
Yeah,
then I don't have to equate it to this fund or that fund.
that makes sense. We'll make sure that's cleared up for you when you make your deliberations for that. I'll note that one. For the next slide, 19,
I'm sorry, 18 was what?
it's housing, and this is really looking at, that funding for that one is a combination of the community development block grant and the sort of federal home funds. And again, we've got a half-time person we're trying to make full-time because the amount of work that we're doing has increased over.
What are they doing? What's their job?
So this position, I have so many in my head now.
This is Lost Lake agreement?
No, this is back on number 18.
I didn't
you're
catch
back
it
on
tonight,
18.
what the actual person's doing.
Okay.
Yeah, so this is on our affordable housing front. This is a position that I think we've seen, to Commissioner Mia's point, we've seen a real strong increase in the number of requests we've had, the complexity of the issues, and then some of the additional grant money we're getting from folks, yeah. And so this is really us looking at the back end of that. So our contracts and invoices, we've needed someone to help us do that work full-time versus part-time. So as we've seen increases, more grants, that's putting more pressure on this half-time position that we wanna see full-time. All right, priority number 19 is the next slide. This is actually something you guys already approved at the Board of Commissioners level. It's an agreement with the Department of Ecology. Again, for these large grants that we're getting, whether it's tipping fees or it's for this or DCOF, we're wanting to make sure we reflect that in our budget process. But this is something that, an agreement you already had deliberated on. Stuart Whitford presented it and you approved, I think this was maybe 3 weeks ago, as the board.
What are they doing over at Lost Lake? I don't remember this myself.
Oh, let me pull it. So it's assisting the Lost Lake RV Park with failing septic systems. The Department of Ecology is contracting with us to support that work. That's what this is.
So are they putting in pumping stations, holding tanks? What are they doing? Cause I don't remember, Ty, did you say we got a briefing? Did you say you remember?
I didn't, I never heard of Lost Lake, but sounds like it's not a lake, it's a trailer park. That's why I don't,
RV park.
Yeah, it's an RV park. It's not actually a lake.
I don't
But
remember
we've got
this.
the same problem up there on Johnson Point, there's a little chute that goes off. It's a trailer park, same thing.
If they were to get a grant, we would help them the same way. So what's actually going on here is this RV park is successful in getting a grant from the state of Washington, but because the money has to come through a government entity that has the administrative capacity to manage the grant, it's going through the county. The county is working with this RV park to manage the grant. So this grant fully pays for the project. The park association RV Park Association was successful in obtaining the grant, and we're assisting them by managing the grant.
We get a little piece of the
We
grant, do
need-
we?
I think we do
A very
retain a
small
very
amount.
small
A
amount
small
for
amount.
admin, but
Yep.
there's not a lot of effort that goes into this because they're doing the work, we're assisting to make sure
I'd
they
like to know more about
contract
that, because I'd
correctly.
like to know why we aren't trying to solve that problem up off of Johnson Point. It's the same problem, and we've been working on that for years and years. I mean, I'm not being critical, I'm just saying, if somebody got it, how did they get it? Let's us duplicate that effort somehow.
Great. Jane knows quite a bit about
Yeah,
that.
Jane knows a lot about it.
Yeah, no, we're taking notes.
So yeah, and this is not the first time we've done it, but because it is coming through a county fund, it has to be appropriated.
I really don't remember this, it must have been
It came through a grant request sometime ago.
sometime back.
Yeah, I can't remember the
Yeah.
exact date, but
I think it was partway through last year.
You know, a lot of times we don't have deep discussions about good things. Usually
That's
have-
true.
We have quite deep discussions about things that aren't very
that's,
pleasant.
that's fair.
The departments are just out there doing good stuff.
Thank you
Hey,
for that.
do we have an environmental health director? I feel like I heard we hired someone and now I've
We,
forgotten.
I had a finalist who, I just showed this to Rob, who, literally just, decided to stay with their current position, so
So we don't.
do not.
Hot off the presses.
Right.
For about 24 hours I did, so. We'll get them. Okay, so that's Lost Lake, priority number 20, again, Corinna, if you wanna talk about this really quickly, again, this is not a request for new policy.
This was approved, let's see, let me pull it up. So this is the, Mark Moffett would have briefed you guys, looks like on August 15th regarding this project. He,
Go ahead.
he had requested to use fund balance to, from millage, if you will, to go ahead and send out RFPs for programs for community outreach to enhance and increase services in the community. He asked for up to $1 million over 2 years, so 500,000. Is that right?
Yep.
2-year period from January 1 of 24 through December 31st of 25. And this was approved, so this is putting that.
We don't scrutinize them quite so close when it's money coming in.
Yes. So this is just asking for the authority to make sure he has the ability to spend that.
Okay.
500,000 or 750?
It's
750 is what we've got listed there total. That might be a typo.
oh, it
in
might
my-
have been on his, I'm looking at the AIS, so I get more information, but that is, it's 750, yeah.
Yep. Yep, I think
Just
it's
say yes is what I'm hearing.
Well,
Okay, so
Why
here's
is
what,
that
so,
in there?
so for next biennium, I'm literally just gonna put just say yes on items.
You have it in there somewhere.
Yeah,
See, I'm
that was
gonna
what I
argue-
put it in there for.
Like, I'm gonna argue with you on the one about the housing, because isn't that really a policy decision to?
It is, I would agree.
This is the millage one, right?
Yes, it's the
Okay.
millage one. I don't know why it says that. It's AIS, though.
Okay. Next slide. This is another position that I'm really excited about us pursuing, which is a procurement and contract specialist. We have so many contracts and so many grants, and I feel like we're always scrambling to try to track, to process, and this would be an FTE that would enable us to really, the focal point of this position would be on our various grants. We're a department that is, I think, at 88% grant funded. And so the bulk of what's our transactions, our funding is coming through grants across the board for each division. And so we'd actually get a person who could actually work in our fiscal office to do this work. And so this is one that if people have favorites in the budget, I think this would be my favorite when I know the complexity of what we're trying to do. Number 22 is actually one that we talked about at the very beginning of the process, which was the Board of Health, and really thinking about having more support there.
Right, before we move off of that one, the working title might be Clerk of the Board of Health, but what we're asking for is a program manager that would do more than the clerk of the board of the county commissioners.
That's what I asked at the Board of Health meeting. It's more,
Yeah.
cause Ramiro had talked about an administrator.
Exactly.
Then there's a clerk, and I didn't even know at the time that we
So
were talking about
we decided to
one-
kind of combine that, if that's what you're saying, is
Right.
that's the, so
But
the
this-
concept you brought up is this is the concept would be right here.
I would think that it would be, the headline should be administrator or program
Administrator.
manager, and then we're gonna fold clerk work into that position.
Exactly.
Otherwise it
should
sounds
not
like I'm
be the clerk
kind
of the board,
I agree.
because if it is the clerk of the board, then we're not paying
I
our
would try to get
clerk.
that through foundational public health if we can. And then on the previous item, 21, I guess I wanna ask Robin, because before David was even hired, I mean, we've had a pretty steady stream of staff coming to the board saying this is an emergency, and it wasn't just one time, it was kind of in at least 2 phases, maybe 3, I'm not remembering, but, you know, and again, I just wanna make sure that what's being requested is consistent with, cause I think you were kind of spearheading it because we had interim, Kurt was here, you know, Shelley was gone, Kurt was here. You were coming to the board saying, we've got all this COVID money coming in. We didn't have enough fiscal capacity before we started, and now we're just getting overwhelmed.
Right.
And that took a couple of phases of multiple FTE authorizations by the board. And so, you know, like now, David's asking for another person, and I need to kind of
Right.
hear that this is not duplicative of what we've already
That it's
authorized and.
necessary. So, you may recall that along with all of the funding that Romero and I strongly advocated for, that the board was gracious enough to grant, we asked our internal auditor to take a look and say, does this solve the problem? And I believe that internal audit identified the need for more support in the procurement and contract
Yes.
area, because this department operates on contracts. Money comes in through contracts, money goes out through contracts. They need a procurement and contract specialist. So I do think that this is necessary. I think that the audit report identified this as a need, and I think this is a must-do kind of a thing.
Just looking for that.
No,
I'm
I-
not trying to undermine you, but I
No,
just,
I think
you
this-
weren't the one that was
No,
advocating
these are
for-
good questions to ask. I
And-
think for me, and I also want to clarify, it's not just an emergency thing. It's not a temporal, like we had a surge of contracts work. This is just our constant day to day. Like, you know, COVID was a nightmare, but public health always has a complex series of contracts.
The emergencies were that the finances weren't being well.
And funding is
Right.
covered by what?
Right, this funding would be covered by.
This is indirect, so you would have seen, there's about 62,000 that is from Foundational Public Health specific for fiscal support. We didn't choose to take this position and say we want to specifically use the 62. What we've done previously is you can charge to the Foundational Public Health allocation indirect. So that's what we did with it, so that this position could do social services, could support that, where Foundational Public Health.
So to answer your question.
I'm sorry.
Ms. Corinne speaking, too technical an accountant. And absolutely accurate, but this will be funded from a wide variety of grants that are received by the department.
Thank you.
Okay, you've just kind of proven the point. I was like, I don't know how you guys keep track of all that. And you've
Wait, are we beating Jennifer yet? Did I cross the
I think
you
it's
threshold?
self-validated the argument of why there's like.
Alright, I'm gonna
Might
send,
have just gone over the top.
sweet,
of
I'm gonna send her a
Jennifer, yeah.
text, let her know. I win. Alright, we're coming to the end. I know we're at almost the end of my time here, so I'll go quickly. This next priority area, is actually, and this is our last one, is that right? Okay. I hope so. I was like making sure.
It is.
This is actually a request that originated in Public Works. And I'm looking at you because I feel like this is an area that's a little bit beyond me. So this is a request that they were making as part of all of the conversations related to like management districts and things of that nature. So it actually started over there. There was some conversation, my understanding, of contemplating where the sort of oversight would go in the future for this kind of work. And this is where I'm looking at you, Rob and Robin, sort of talk a little bit more about.
Yeah, and I don't think this was really intended to be specifically just, this wasn't an LMD thing, right? This was looking
Bigger than
at
that.
stepping back and looking at a more holistic level, being able to do some type of a study to really identify BMPs or whatever else that could be incorporated relative to how lakes are supported.
Yeah, I mean, I think it really, well, it's not, I appreciate what you're saying, but it really is kind of about the LMDs. And I can just tell you that I will not be supporting a reauthorization of any LMD until we have this information. I need to know that we are on track with best practices, that we are directed our efforts with the LMDs in the most environmentally sound, cost-effective way. And I don't quite have a good sense of that right now, and this is to me an absolutely foundational element to us moving forward with the very haphazard approach we've had in the last 5 years with regard to lakes.
And what fund again?
I don't, it says
Environmental
environmental
health.
health.
Yeah,
Or what
Foundational.
what source of funding? Oh, it's not FPHS.
Foundational public
No,
health.
but
No, I actually think
I
that
thought this was a general.
I think that the original request, again, we are basically transferring the request from Public Works. I believe their plan was for it to be a general funds request.
They had planned on asking for from general fund, but I think we can get a little creative with our water funds.
yeah, okay.
What's the number?
Because this is one of the items from the board's brainstorming session on priorities, on a way to move forward with some type of countywide healthy lake program.
This is part of how
Yeah.
Public Works convinced me to move forward with Pattison and Offit Lake, given all the problems we were having with the two existing LMDs and Black Lake and
Right.
Summit Lake. And I kind of swallowed a lot of concerns that I had and still have because I thought we're going to get some comprehensive information on how we can move forward in the best way for the
And then
county.
it went nowhere.
And you know, and here it is.
Here we are.
So this one, I'm coming a little bit new to that one. I don't have a lot to add. But I appreciate that.
Welcome to Lake
I'm
Management.
about to say.
I know.
I'm so excited.
Okay, any questions for David?
Oh, I suppose it's not time to talk about restaurant inspections and stuff. We'll let that for another day.
Happy to.
Okay, treatment sales tax is next. Do we wanna take a small break or do
Yes,
we
we
wanna?
do.
Yes, we do.
Okay.
Yes, we do.
You're the first one. to
Okay. We'll start at 3:30.
Okay, good afternoon. We are back from break. It is 3:33 PM and we are picking up with treatment sales tax.
Good pass right over.
Shaylin, go ahead.
Hello Commissioners, my name is Shaylin Sowers. I am the Treatment Sales Tax TST Program Manager. And today I'm going to be presenting on the Treatment Sales Tax budget on behalf of the Treatment Sales Tax Advisory Committee. Like David, this is also my first budget cycle.
I got confused when we switched mice and all that kind of stuff, so.
It's all right. All right, so treatment sales tax, TST, is a 0.1% sales tax dedicated to support the operation and delivery of new or expanded therapeutic court, mental health, and substance use programs and supportive services. In 2022, revenue was approximately 8.3 million. The Treatment Sales Tax Advisory Committee is a group of 9 volunteers appointed by the board. And the committee goes through an extensive process to develop their budget recommendations. So this includes reviewing performance data, meeting with TST funded programs, and discussing all budget requests, including historical spending and performance measures. Thanks. And so TST manages Fund 1180, and as you saw in the public health presentation, here are the estimated beginning balances, proposed revenues, expenditures, and ending balances for 2024 and 2025.
So before you move on from that, I will just mention to the board that the financial plan for TST is in the packet of funds that you receive from public health. So if you find this packet where the top page is the environmental health fund, if you turn the page, it's the second,
What's the number?
the number is 1180. See it?
Yep.
So you've got this,
Just have to find the right page.
and you'll see the dilemma.
34.
You're the one looking at it.
Sorry to interrupt, Shirley,
1180.
go ahead.
Sorry.
How to open a new tab.
All right, thanks, Robin. And so, so the committee's recommendations for 2024 are based on 9.87 million in expenditures with a 10% reversion rate. And for 2025, their recommendations are based on 10.1 million in expenditures with a 12% reversion rate. And so these expenditures and reversion rates were adjusted slightly based on the way TST financial plans have been developed historically, in which the total expenditures in the plan are adjusted such that the end balance at the end of 2024, or at the end of 2027, excuse me, so at the end of the 4 years, matches the recommended 2.5 months of cash flow. And so there's been some process changes, so TST will align with the budget office's process in the future. So here are total FTEs, personnel expenses, and other expenses for TST. TST does not have a general funds budget. 2 FTEs administer the TST program, which includes the program manager and data analyst. The other FTEs are staff from public health, district court, superior court, juvenile court, public defense, pretrial services, and the corrections bureau. One thing to note about FTEs is that some of the prosecuting attorney's office and public defense staff enter their time spent on TST qualified activities directly into payroll, but do not have any of their portion of FTEs allocated to TST. So in 2022, TST spent 2.9 million on personnel and 4.9 million on other expenses, including personnel not allocated to TST. In 2023, TST spent 3.4 million on personnel and 7.6 million on other expenses, including personnel not allocated to TST. You can see an increase in the proposed FTEs in 2024 and 2025, and you'll get to hear more about the proposed position requests for the biennium.
The whole, not allocated, FTEs not allocated to TST's technical thing in the system, the fund pays for the part where that employee is working on TST, so that's
And the TST
not really
funding,
relevant.
the TST funding is a department as well.
Yes.
It's not a cross between public health. The money sits in public defense, for example. It's just not tied to
That's
an
right.
FTE.
So how does it go from 28 to 37, but the numbers and personnel are the same?
This is going to be a situation where they were doing reclassifications. It was what I talked about this morning when the prosecuting attorneys was in here, that in the system, there's a technical
There's a
issue with
glitch.
reclassifications that counts it as another position, but it is not.
So don't fixate on the number of FTEs going up in this chart.
Okay.
We gotta fix that,
So don't have a heart attack when it goes 10 more.
right?
Good.
Yeah, cause if that's true, then they're not getting paid very well, and that's, they're just gonna leave, and that's not gonna be good expenditure of money.
In terms of opportunities and challenges, as you know, revenue projections for TST budget in 2024 and 2025 are lower than previous years. You're already aware that while TST tends to have a high fund balance, there is a historical trend in underspending. And based on the financial plan with the adjustments I made for expenditures and reversion rate, the committee's recommendations are based on a budget of 10.8 million in 2024 and 11.3 million in 2025. The committee recommended allocating historically underspent funds towards new budget proposals, as I'll describe in a later slide. The committee is,
Oh, my bad.
The committee is committed to supporting TST-funded programs and advancing diversity, equity, and inclusion. And the committee expressed interest in TST-funded programs demonstrating more concrete impacts and outcomes of their DEI work, including staff training. Thus, TST is going to be partnering with the Racial Equity Program Manager, D.V. Ogden, to design SMART objectives for the new biennium MOUs in alignment with the finalized Thurston County Racial Equity Plan. Next slide.
Sorry.
That's all right. Thanks. I'm sure you've heard about challenges with recruiting and retaining staff, and many TST-funded programs have also struggled to maintain service levels with this challenge. There were several budget proposals for new FTEs, and the committee considered various funding strategies, including partial funding in 2024 to account for a hiring period, which may vary by office and department. And the committee prioritized areas of high impact where the program or the proposal met more TST policy goals. However, not all new FTE requests were recommended. During the COVID-19 pandemic, we did see service levels drop, and this year we are starting to see the levels gradually increasing, which is great, and some programs have even returned to pre-COVID levels. And lastly, the committee is exploring standardization of performance metrics. Standardization would allow the committee to compare performance and impact more easily across a wide range of programming. At this point in time, it's sort of like apples to oranges sometimes, so standardization would help address that problem. And I'll pause here to see if there's any questions about what I've covered so far. Okay, awesome. So this slide summarizes the total amount of funding recommended by the committee in 2024 and 2025 by maintenance level costs and new budget proposals. So how the committee went about their ranking is they ranked each maintenance level and new budget requests on a scale of low, medium, and high priority based on how many TST policy goals the program or request met. And these 7 policy goals are detailed in Title V, Chapter 5.49 of Thurston County Code. The committee met 3 times in September to discuss their rankings, review historical spending, existing performance metrics, and level of need in the community.
Did you basically zero base this budget? Did you zero base the budget?
Basically, yeah.
Yes.
Looks like it, yeah.
Which is,
No wonder that was a difficult,
there were a lot of requests.
Did you guys, I mean, you'll probably get there, but at a high level, in the past, TST committee has like made recommendations to reduce funding or eliminate programs as well as add new. I mean, they haven't just accepted maintenance level base and then added to that. They had to have done that, right? Because of the static revenue.
So with the, so in the past, as you know, with TST, there's typically been such a high fund balance that there hasn't been as much of a concern to make cuts or reduce things in certain areas. Of course, they still go through, they meet with all of the programs and they talk about sources of underspending, challenges that they've seen in the program, other sources of concern that might want to impact their recommendation for the cycle. And so I wouldn't necessarily say that they would just approve it across the board, but it still goes through that whole entire process of review.
And did they come up with things? I'm just saying in this specific proposal, are there gonna be recommendations to reduce funding or?
Yes, I'll go through that.
I don't know if this is possible, though, some of these maintenance level items. So for example, the domestic violence case coordinator in Superior Court is an FTE, isn't it?
Point two, it's, covers point two of the FTE.
Point two of an FTE is $70,000. What does this cover?
The next slide.
I apologize, I misspoke. It's approximately 0.5 of an FTE.
It's a half an FTE. And we funded it $119,000 in the past, a half an FTE.
So I'll go through some of the background and why they came up with these, and that would be
Okay,
helpful.
I'll let you go through them.
Okay, so the committee recommended full maintenance level funding, and by maintenance, I mean projected costs of traditional spending in 2024 and 2025, with the exception of the following adjustments on this slide. And so the first two programs are run by the Corrections Bureau. So the first one is for the TSC Coordinator Program. This coordinator runs all of so they oversee and help administer TSC funded programs in the Corrections Division at the Sheriff's Office. And so the committee recommended $110,000 a year based on historical underspending. And so, for example, in 2021, the program spent about $100,000 in TST funds and $95,000 in 2022.
So does this support an FTE?
Yes, it does. It's one FTE.
One FTE, and what is associated with that FTE that makes $210,000 a year in the 24 request? Do they contract out? If that is the cost of a FTE in corrections, which totally could be, then by going down to 110, the question is, why were they underfunded or underspending in prior years? And if it was due to vacancy savings, then this would leave a partially unfunded FTE, and we don't do that in the county. So this would not be a recommendation that the board could even consider.
This includes, we might need to have a conversation about this, but I'm looking at the line item budget for corrections treatment sales tax. And it includes some money and for overtime in here. And it also includes things like the uniform allowance and holiday
Those are all
pay.
necessary
Right.
items for a corrections deputy.
And that's just on the salary side.
Right, so this, I'm respectfully questioning the approach that was taken.
So we'll have to revisit some of these. If they're lined up with an FTE, as Robin's speaking, then you can't just underfund the position. So if it's a one FTE, it costs what it cost. So we can't just do it in half.
Understandable.
So we'll work together again to look at these line items.
Yeah.
and
Definitely.
Make sure that these recommendations are something that you could
Also-
actually take into account.
If they're not tied to an FTE, I kind of want to see the 2023, what they were funded at.
Yeah.
Just because as we're going into 2024 and 20, like it helps my brain, again, just kind of see that comparison.
Yeah, because maybe TST is just maintaining what they were at and when we're not, so just so I understand this chart. Let's take the first item. You say Corrections Bureau, so you're saying the Sheriff's Office is requesting 209,000? No.
No, that's what they already have in their budget. They already have funding for this. And what the committee is recommending is to reduce their budget because they've had previously underspent in that area historically.
By $100,000.
Which could have been vacancy savings, it could have been because that position had to be redeployed in the jail due to their understaffing. There's a lot of reasons.
Population was down for a while too with COVID.
Exactly, from COVID protocols alone.
Okay, and TST coordinator, like I thought you were a TST coordinator,
This
so
is
what is
for,
that?
yeah, this is specifically in the, for the sheriff's office programs. So this covers, the chemical dependency program, inmate mental health services,
All the
prepar-
treatment programs
yeah,
that we provide in the
reentry
jail.
employment.
And we've had this position?
Yes. It's occupied by Lieutenant Stephanie Klein.
Oh, so it is an FTE.
And we're not gonna cut her to part-time, so.
Right, so what's the TST committee's thought process to make the 110? Can you just walk me through that a little slower?
Yeah, and so it was based off of the historical underspending. So the program spent 100,000 in TST funds in 2021, 95,000 in 2022, and then let's see. Yeah, so that was what the recommendation was based off of.
Do you know, did they have somebody from the corrections department there? Was the chief there or anything during some of this negotiated discussion?
Not during the actual discussion itself, but they did come in to present.
Did
I
they,
mean, I'm just saying it's confusing. I mean, I don't know what the committee thought. I don't wanna speculate, but for me even, it's pretty, it's confusing sometimes because you do have certain employees where they can bill their time here, there and everywhere. And it's a matter of like, oh, they're doing a third of their work for substance use folks, they can bill the TST. But they've got other stuff they can do.
right,
Sounds like a different situation where it's like, it's an FTE, it's not just like you cut them in half, then what else are they doing? Who's
And they're at,
paying that?
and I'm glad that you bring up that point too, because that has also been a question of billing time towards different activities, cause this position also has other responsibilities, not just dedicated to the TST programs. And so their time does get billed in different ways, but for the TST qualified ones, it does get billed, so.
Which was partially why they were underspent in the
Yeah.
past. So the committee made a simple decision of, they were asking for 200,000 in previous years, they only spent 95 or 100. Cut it down so they have money extra for.
So it
elsewhere.
could have been, I mean, in theory, it could have been someone that just didn't have, it's almost like CPED situation, like they might have just not had enough of their time that connected to this, and it might be something we really need to do or have to do legally.
The other
Versus
thing-
versus it's only half the time because they were only filled the position half the time.
Right, it could be that. It also, 21 and 22 are extraordinary years. We've got record level of vacancies in the jail. If you only looked at those 2 years for the trend, recognizing that that trend could continue into the past, but those are, the sheriff's, he shut down the options programs to be able to run the jail because of his vacancies. If he gets the vacancies filled ever, then this person would then probably return to these programs that we absolutely want them to be providing in the jail.
The budget office can work more closely to clean up these numbers and be able to present something to you during
Does
deliberations.
Heidi have an answer for this maybe from?
I don't know if she would. This is the first time I'm seeing this, and I don't know that she's seen it.
Okay, let's move on to the
If,
next one.
but you keep going.
All right, and so this is for inmate mental health services, another program that's run by the Corrections Bureau. This is specifically for their psych ARNP program. It's a advanced registered nurse practitioner. And through the psych ARNP program, they prescribe and manage psychiatric medications for those that are incarcerated at the Thurston County Jail. And the committee recommended 120,000 per year. Since last year, they spent about 107,000.
Is this through a contract we have with?
I'm trying to pull that up right now, actually, just to clarify.
If it's contract, we have to fund at the contract level, the amount that the board approved in a contract.
Or some contracts though are pay for what you use.
Yeah.
And with population down, there'd be less use.
I'll need to follow up on that question.
Okay.
And then for the domestic violence case coordinator through Superior Court, this is a 1 FTE, provides monitoring, case coordination, and referrals to domestic violence cases. And so TST funds partial staffing support, approximately 0.5 FTE needed to operate the coordination services. And so their committee recommended $70,000 per year. Since 2019, the program has spent approximately $53,000 on average, with the highest spending in 2021 at $60,000. And then for TST administration through Public Health and Social Services, this is the administration by the program manager and data analyst. In 2021, TST admin costs were about $433,000, in 2022, $347,000. Hence why the committee recommended about a $200,000 decrease from the projected maintenance cost shown here.
Can I ask a little bit about the TST administration? So you said two positions, right? Yours and the data analyst. And I'm just wondering where the request came for 633.
So this is the projected maintenance level cost in 2024 and 2025, so it's not necessarily a budget, like a new budget request, it's just the projected of traditional spending in 2024 and 2025.
And what did that cover?
And so that should cover the program manager and the data analyst position, and it also covers some naloxone as well, I believe. Yeah, and training costs for the National Association of Drug Court Professionals Conference for some staff to go to.
And some administrative overhead that's allocated, and
Indirect
the
costs,
indirect
right?
costs are in here.
So this is a perfect example of what, but so why was it only 433? Because it took a while to get your data analyst or something like that?
Potentially, yeah, so in 2021, I do believe I think it was in 2021 that the data analyst position was vacant for some period of time, and then now there's been some vacancy, but not too long with.
But now you're full, so why would the committee have said you only need what you got what you spent when you had vacancies, when we don't have vacancies now?
I think those are good questions.
Nicole and I will be working
Yeah,
on
we're following up. I would like to go back, if I may, to the Corrections Bureau. They have this position fully allocated to treatment sales tax, but according to payroll, only 25% of her salary is billed to treatment sales tax.
So it's probably just a pending.
That's a problem we got with the sheriff then.
So, I mean, so that's probably why they were showing so much under expenditure there, because they weren't charging
Well,
that position
I'm
for
wondering
there.
if it's because, right, they were doing this, but then as the shortage went
It's
on, he
the-
might
yeah.
have deviated it to,
You can't charge time.
But you can't charge time.
Exactly.
so that's why he probably just didn't,
That's why I'm saying this is a unique time in the jail.
Yeah,
I've
so
never seen vacancies like
there was
this.
maybe we need more corrections officers and we're gonna transfer this person to do this instead of being a TST coordinator for now and only charge 25% of the time of when they're actually doing that. Okay, but then that leaves like a huge gap for us.
When
Okay.
these agencies came to present, they presented what they wanted. And so when the committee then was trying to decide, they didn't have all the detail, right, of like, what is an FTE cost or what is this, right? So they're basically just looking at the metrics of what was spent in the past, some of the data metrics of the client served, for example, in future programs, that sort of thing. So they don't have the whole picture.
But they should have had the whole picture, and if they had those questions, we should have been answering them before they went down this path.
The process can definitely be improved.
I mean, I've worked with the committee in prior years where they adjusted things down, but when they adjusted it down, they were very specific of what they were eliminating to be able to achieve the savings. We'd eliminate an FTE, we'd cut a program, we'd reduce contract because they'd never been used. You didn't just reduce it and wonder how they were gonna get to the savings.
This is just a recommendation from the
It is
committee.
only a
We
recommendation,
get
and what
to
I'm
have
saying,
the
this makes
oversight.
it very difficult for you.
Thank you for the feedback.
You get to come back again.
And so the next one is Veterans Case Manager through a Public Health and Social Services. And so TST funds 0.2 of an FTE for a social services programs specialist position with Veterans Case Manager. This position connects veterans who have mental health and or substance use disorders and are justice involved with treatment support activities and services appropriate to the client's needs. In 2021, approximately 2,600 in TST was expended, and in 2022, about 5,000. The program did experience some challenges connecting with clients at the Thurston County Jail due to COVID-19 outbreaks and also experienced some staff turnover, which led to some underspending. Thus, the committee recommended a decrease from the projected maintenance cost to $20,000 per year.
Why isn't that position being funded fully through the Veterans Fund?
I don't know.
It cannot
It
be
cannot.
funded. We looked into that.
Yeah.
It doesn't allow for that. Because the Veterans Fund is only for indigent veterans, and this doesn't have just indigent veterans.
Okay.
Okay, and for law enforcement assisted diversion, LEAD, this is also through public health. So TSD funding is allocated to LEAD to match funds for a state grant to Thurston County for implementation of the program operating costs. Funding can be used to support a portion of the contracted case management and outreach services, assessments, housing assistance, many more other things. So TSD funding is allocated to, that has been allocated to LEAD hasn't been spent due to being sustained by the state grant. However, they are anticipating a new 24-month contract from the state that's not going to provide enough funding to sustain the program for the entire biennium. Thus
So is the 100,000 on the table going to continue the program and fill the gap that the new state contract creates? Because that is the reason that this funding is there.
Yeah, thus the committee's recommending 100,000 to offset what the state contract won't cover.
Can you explain the 200,000, like?
Why is it
wh-
301
why-
in there?
Yeah, why
Who's
did
re-
they?
Who's requesting 301 if that's not?
I think that maybe it seems like the two columns for the 2024 request and the 2025 request is a bit misleading, so I apologize for that. So the 2024 request and 2025 request numbers just come from the projected maintenance costs. It's not necessarily what the program is requesting as far as a new budget proposal. It's just what the cost is to sustain them at the traditional current spending in 2024 and 2025.
Because there was a previous budgeting of 301,000 for that?
And so it takes into account inflation, things like that.
Okay, and then, so you're saying that with the 100,000 and the state contract that
That's
they'll
full
be,
funding.
that's full funding and they'll be able to,
With the 100,000 per year, yes.
I think from the full board, I think this is definitely like this priority.
It's a
I
high
mean,
priority of the
it's,
board.
so we wanna make sure that, you know, this program is being funded and so if that 100,000 per year is gonna cover that gap, then I think we're good.
Moving on to syringe services or naloxone through public health. So syringe services, also known as drug user health, has been allocated $15,000 per year since 2021 to purchase naloxone kits. And in 2021, 2022, about 99% of the funding is spent, so it tends to be very well spent. In 2024 and 2025, they have asked to increase the number of naloxone kits, which PHSS is able to distribute to the community. They've also asked funding to supply naloxone kits to law enforcement agencies. And so these totals shown here represent the committee's recommendation to fund the cost of, to purchase 1,272 naloxone kits for community distribution and 624 naloxone kits to provide law enforcement agencies in the county. This request did not get into the budget process in time, so the ask is represented here.
This be covered with foundational public health.
It could be covered with the opioid settlement funds.
Yeah, but that's going through
Through
It has to go through the,
Separate
would have to go through the committee, but naloxone is number 1 or number 2 on the items that the settlement money can be used for.
Absolutely.
I wanna spend that money.
And lastly, we have community grant awards through public health. And so as you all probably heard about earlier on this week, the committee recommended $800,000 per year for community grant awards. And so this is a decrease to allocate more TST funds towards new budget requests.
Didn't we start, 4 years ago when I was started, wasn't it like 250?
Yes.
So
It started at 100.
yeah, so
Yeah,
in my
it's-
opinion, if we needed to fund nurse-family partnership or some of these backfilling,
Yeah.
these things that would be where I would look to reduce, cause
That's,
we were making do with 100,000 when I
That's
started
right.
on the board.
We had so much money in fund balance.
We
that
just increased it
doubled
just because
this.
we were trying to spend money,
Yeah,
right?
Because we had the
But
funds.
now we have
yeah.
other places to spend money.
right.
Just for your awareness, the committee was very hesitant to cut the community grants.
Okay.
That's where their feeling was.
And part of the beauty of these community grants is it filled gaps
Exactly.
that county offices and departments, services that weren't being offered. And some of our community providers were coming up with some very innovative ways to provide treatment. So they've been extremely effective, but you're absolutely correct. They've just grown exponentially.
But if we have a $200,000 gap in TST administration, that's
Yeah,
pretty critical too.
Yeah.
right?
yeah. Yeah, not saying that the other things are not as important, but
I mean, if it
it's
comes to
sad to
that.
have to cut them back
Yeah.
now,
I think we just need to see the
whole thing.
whole picture, right, of like employees, right, and not making sure that we're not cutting those employees and or FTEs and just I think once we have like the full picture of the actual maintenance cost and the number and then the committee recommendation and then I'm gonna call it the must-dos as well on this list, I think then we'll have a better picture on how much we can actually give out in community grant awards.
Plus, when you're talking about filling gaps, I mean, Commissioner Mejia and Public Health Department and Providence have identified a gap.
Right.
So, I mean, that's what we'd be doing with the money. It wouldn't be like wouldn't be filling gaps.
I agree.
Right. These next few slides go
I'm
into.
trying to help you to get there.
I'm like, yes.
It is complicated.
Yes. These next few slides go into the committee's recommendations for new budget proposals. So this first one is from Superior Court. This is a request that is for DUI and drug court, family recovery court, and domestic violence case coordinator. It's for maintenance funding to increase costs for court security services. And so these are part of the services provided through TST Superior Court programs. And this request it decreases general fund expenses and reallocates those expenses to TST. And the committee recommend full funding and saw these security costs as an unavoidable cost of providing services.
Did you just say court security?
Yeah, I don't see this
Any,
you said it, but I don't see it on the slide.
Yes, it's in the request itself. It's not represented in the title.
So it says treatment sales tax cost allocations. I don't know what that means.
So the request itself, so in the details of the request, it's for court security services.
Security services.
So I think this is similar to what we were talking about with David, with some of the offices and departments don't tie the FTE to the funding. And so they make, Robin, I know you don't like this either. So they do a swap and they say, this is what our FTE is funded at $100,000. And instead of saying it needs to be 70-30, they get the 100,000 in general fund and then there's a swap. And so they get the 30,000 in treatment sales tax and they bill it instead of saying this is gonna be a 70-30 split. So that's some of this.
What's the nexus here? Is somebody doing security at a drug court hearing, or what does that have to do with
Yeah.
substance abuse treatment?
So yeah, so it's part of actually providing the program itself. Jen, did you have
Nope,
something?
nope.
How
Oh,
is
yeah.
that?
Yeah,
I'm just agreeing.
Yeah, just the part of the security, so they have to have security.
At a therapeutic court hearing?
I don't know about that specifically, I don't know the answer to that,
Just
but
be
for
any
DUI,
court.
drug court, family recovery court, and domestic violence case coordinator, it sounds like they, as security services are
We'll
part of the.
follow up
Okay.
with Superior.
Yeah.
yeah, please, because I mean, they have corrections there. They have, I mean, there's
I don't
court
get
security, we
this.
already are paying court security from the general fund and
Well, it sounds like they wanna shift part of the general fund cost to this fund, but I don't understand
I'm
the
not seeing the
nexus.
nexus there too and seeing that things are tight, I just, okay.
Or they're tight in both places, but
Yeah.
it's,
But the committee was convinced that
committee
this
thought
was a
this
good
was-
idea?
As part of, they saw it as an unavoidable cost of being able to provide those services, is having security.
Just having the drug
Like
court.
they haven't had
Or the mental
security in
health
the past.
I don't, I think they've had security in the past since it's just a reallocation from general fund to TST.
When I look at the lines, it's associated with a number of FTE. And it is just a portion of that FTE's time now being charged to TST. So it may be something that was already in our budget, and I will verify, but now that we have refreshed the numbers in our system and the way that the budgeting is done behind the scenes, we have to now put it back in TST,
And then we correspondingly reduce the
general fund portion.
general fund part, so it's an accounting issue, sort of?
Yes, but we'll
They
verify.
were
sense that it-
authorized for TST and they weren't charging it to TST? Is that what I'm hearing you say?
No, so it seems as though the entire FTE is budgeted in general fund.
Right.
And so they're asking for that reallocation instead of doing the split behind the scenes where every time that person's payroll comes, that it gets charged to general fund and to TST, that they're doing a behind the scenes accounting entry into it. So when our numbers get
Told them not to
refreshed.
do that.
And I
Yeah.
think that's what this is. So I'll verify, but it looks like it's the behind the scenes manual transaction and
So
so.
my question is, have they been doing this in the past or is this new?
It appears to be that that's what it was set up the way, they've been doing that manual
They've been
transaction.
doing it.
They've been
Yes.
doing it this way for a while.
Then this is a maintenance level thing.
Right.
Why are we looking at it in this way? All right, so well, let's keep going. We're
Well,
gonna
what you'll see
figure out
is, under the
exactly.
proposal is the title sort of, but then, yeah, all the detail was in when they did the presentation and what they wanted, so that's
Well,
what
that's
Shaylin is
what-
reading, yeah.
Commissioners need is the detail.
Yep, and she'll give that to you, yeah.
All right, for district court, these are all requests from Mental Health and Veterans Court. And so for the first one is a TST care coordinator reclassification. This request sets the salary range from the Mental Health and Veterans Court care coordinator position from range 12 to range 15, so it's about 5,000 to 7,500, to more appropriately reflect what the position entails. So this request will impact 3 care coordinator positions, and the requested budgeted amount includes all 3 positions. Care coordinators assist participants with accessing community resources in lieu of incarceration, maintain compliance with court obligations, and many other functions. And the committee saw that this request as meeting a greater amount of policy goals in support of retaining qualified staff for the program. The committee recommended full funding. And the next request is for a reclassification of the program manager in Mental Health and Veterans Court. So it sets the salary range from grade 426 to 544, so 7,000 to about 9,500. Responsibilities of the program manager, they oversee the program, clinical operation aspects of the mental health court, and they develop policies and procedures, much more. And between 2021, 2023, there were 3 staff that terminated employment with the court for higher paying positions, and the whole team is 5. And they also had to repost this position multiple times due to an inability to hire, so it left the manager position open for 6 months. Thus, the committee saw this request as supporting the retention of qualified staff, and also the program seems to accomplish many TST policy goals, so the committee recommended full funding. The next request is for an administrative assistant. This would increase their position from 0.75 FTE to 1 FTE and allow efficient support of all 3 care coordinators with a full caseload. And again, the committee saw this as supporting the program and recommended 75% funding in 2024 to account for a 3-month hiring period and 100% funding in 2025.
Do you know if this position is filled right now?
I'm not certain, we need to follow up on that. The next request is for training and professional development funding. This would be training and conference funding for judges, management, and staff. The committee recommended about 1,700 in 2024 and 1,900 in 2025 to provide some funding for training, and felt that the reclassifications, as well as some other new district court staff requests, they accomplished more policy goals than this specific request. And then the last one is for equipment funding. There's currently no funding available that allows for the replacement of failed hardware or modernizing services to support participants in the program. And so they requested 3,000 in 2024 and then 2,000 in 2025, and the committee recommended 2,500 in 2024, 1,500 in 2025, and still felt that this amount could support the ask. These next requests are from mental health probation. They requested 1 new court assistant 1 position. There's currently no administrative support for the mental health services division of the probation department, and so the probation counselors have to perform all of the admin tasks, which takes away from their specialized work. The committee did not recommend funding towards this request in order to prioritize requests that would meet more policy goals, such as the probation counselor in the next request. And so the probation counselor request is for a counselor 2, adult probation counselor 2. The program's currently at capacity as the current probation counselor has 40 to 42 active clients. An additional probation counselor would allow them to double their caseload and then increase resources and dedication to clients. The committee recommended 75% funding in 2024 to account for a 3-month hiring process and 100% funding in 2025.
So, I'm sorry, what's the difference between those two? The first one is not a probation counselor, it's what?
A court assistant.
A court assistant. Okay, what is that? Madam Chair, you have the expertise to tell me what a court assistant does. Don't you?
Not for district court, I don't. I'm not sure what this position would do for district court, so I'm sorry.
No, that's a partial answer.
This would be administrative. So taking the administrative work off of the probation counselor's plate, so the probation counselor can counsel.
And did we hear about, I remember hearing about the second one from Judge Buckley.
We heard
Did
about
he
the
talk
first one.
about first-
He did.
I'll just have to go back to my notes on that one.
It was their, yeah, it feels like such a long time.
It was like 17 presentations ago. Doesn't swipe
It was
as
their
fast as I
policy
wish.
priority number 11. So it was lower on their list.
Doesn't want to get me. Okay.
Okay.
Moving on to juvenile court. So we have juvenile court has a program called Equine Assisted Youth Peer Support. And this program is just requesting maintenance level funding to add funding to the Heart Strides program. This would cover an increase in scene and facility rental fees, horse lease costs, care costs, general program supplies, and personnel costs. A majority of the increase is due to increases in facility rental and horse care costs. And the committee recommended full funding. Pretrial services diversion, they requested 1 pretrial services officer to serve 50 more clients at any given time, including those referred to diversion due to drug possession charges under Senate Bill 5536, which makes possession of a controlled substance a gross demeanor. And I'll go through this other request too, and then I'll explain the background on their recommendation. This ties in together. They also requested an admin assistant 2 to provide support and structure to the department. The department currently does not have any administrative support, so the basic functions, again, similarly that we saw with district court, falls onto the staff, the probation officers. And so this specific for the admin assistant, this is specifically the cost of 36% of the position, which accounts for the portion of time that's spent towards TST funded programs. So the committee, while the committee did not recommend funding for either of these proposals, and while they did agree that the diversion officer would increase service levels and the admin assistant would support that, they just felt that the budget proposals for the resource hub operations assistant was a higher priority and met more policy goals. And thus, the resource hub requested one operations assistant. And so there's currently 1 staff person allocated to run all the aspects of the resource hub, and this is the resource hub program manager. And as you may imagine, it's challenging to manage all the day-to-day operations, develop partnerships, go to county meetings, find coverage for planned and unplanned leave. And so the committee recommended 80% funding in 2024 to account for a brief hiring period. The pretrial services anticipates being able to hire for this position quickly, and they also recommended 100% funding in 2025. For public defense, they are requesting a expansion of their social work program. This will be 1 FTE social services specialist to expand the program to 2 total social services specialists. So this additional social specialist would improve release planning, case management, crisis management, advocacy, referral services, and also substance abuse evaluations for public defense clients with identified behavioral health needs. And the committee saw these services as a high priority and recommended 50% funding in 2024 and 100% funding in 2025. Moving on to requests from the Corrections Bureau, the only one is from preparation for re-entry. And so this program is, it provides pre-employment training workshops and services to adult inmates at the Thurston County Jail. So they have to be enrolled in chemical dependency or inmate mental health services. So it's the goal that the participants will become gainfully employed. This request is additional funding to cost a 3% cost of living increase, and the committee recommended full funding for this request. Moving on to public health and social services. So you heard about these requests in David's presentation, so I won't belabor the details too much. For the first one, this is from, so for all of these are from Nurse Family Partnership. And as Commissioner Mejia already discussed, the NFP program has over 110 people on their wait list. They're seeing a growing number of high acuity referrals and client needs. And the committee saw this position as a high priority request, considering that they'll be able to help address the wait list. And they recommended 50% funding in 2024 and 100% funding in 2025. The next request is for leadership capacity. This covers 2 FTEs, an NFP manager and a community health nurse supervisor. And in an effort to stretch TST funds to the highest priority areas, they saw that the NFP manager position would be able to provide leadership structure needed to sustain the program. And so they recommended just the NFP manager, and they recommended 50% for the NFP manager in 2024 and 100% in 2025. The next request is for a community health worker. This is 1 FTE, and this would be a bilingual community health worker as already described. And so this position would also be able to help with referrals or the first contact for referrals. They provide resources for those that are on the wait list, support high-risk families, translation to Latino families. And so the same reason for the social worker and NFP manager, it's seen as higher priority and recommended 50% funding in 2024 and 100% funding in 2025. And the last one here is for divisional support capacity. This is for 1 FTE community health nurse. And so while the committee did recognize that this position would add support to alleviate the wait list, the committee did not recommend funding for this so that the social worker, NFP manager, and community health worker requests could be funded.
So what's the difference between medical social worker and community health worker?
So the community health worker, so yeah, they support the team and families. They have the first contact of referrals, provide resources. The health worker and
The medical social worker has a higher license and level to deal
Yeah.
with mental health issues.
thanks for that.
So they're both kind of on the ground workers with families, kind of frontline folks, just with different.
For resources and one's
qualifications.
more the higher acuity needs.
The intention for the medical social worker is to support clients who are experiencing mental health concerns and crisis or substance use crisis.
So there were 5 FTEs requested from TST for NSP, for NFP. And the committee said they would fund 3 of the 5, not doing the nurse, the last nurse. And again, I'm not sure the difference between the social worker and the health worker and the nurse. They're all meeting with clients doing, I'm confused between those 3.
The nurse can actually do the clinical functions and by the fidelity model of the program can help the family through the entire program from pre-birth to age 2. The social worker then, the nurse can transfer families to this medical social worker for higher end mental health needs that the nurse is not qualified to do.
And what about the health worker?
The community health worker is the very frontline for people needing to line up, access to healthcare or other support that is not a clinical function,
Would one family potentially see all three of those people?
potentially.
Okay, so, and then there's two leaderships, so they wanted to do one leadership, the medical social worker and the community health worker, not the nurse in the second.
Not, yeah, correct, not the nurse and not the community health nurse supervisor.
Okay, got it, I guess.
Next slide. This last one is the treatment sales tax reclassification. As you heard before, this is a request to reclassify the program manager position for TST, which would be my position. The committee did not recommend full funding so that they could provide other, provide funding for other requests with higher impact on service levels. Next slide.
So, okay, so that wasn't part of the other TST administration piece. On your first slide, you had 600,000,
Yes,
they
that's
funded
correct.
400,000, separate issue as a reclass.
Correct. On this slide, this is for programs administered by the Thurston Mason Behavioral Health Administrative Services Organization, which I will refer to as the ASO. And so the first one is for the housing case management rental assistance. This housing case management, they provide housing case management rental assistance to individuals with behavioral health disorders with the goal of supporting stabilization and recovery. And this request would allow the program to assist approximately 13 more people in obtaining housing assistance. The committee did not recommend funding in order to support other ASO requests that they perceived as achieving more policy goals. And the next three requests are for the jail behavioral health program. This is run in the Thurston County Correctional Facility. And so the jail behavioral health program, JBHP, they provide clinical mental health and crisis services to adults in the facility. And so some important background to these requests is that the services that operate at the jail there are some services that operate out of the jail and they're directly overseen, paid for, and contracted for by corrections, but more and more services that take place at the jail are overseen, paid for, and operated by the ASO. So that's why these requests are coming from the ASO instead of corrections, because these are the ones that are overseen by the ASO. And as some additional background, the ASO did inform the committee that they anticipate receiving True Blood grant funding that could cover a portion of these requests, which did impact the committee's recommendations. And so, because there is a lot of overlap between what True Blood and TST can fund. So going into the request, they requested one FTE substance use disorder professional that they would primarily work at the Thurston County Jail. And so with the recent passage of Senate Bill 5536, the Sheriff's Department might be arresting and detaining individuals in possession of illegal substances as appropriate. And so they may have substance use disorders and could be served by this position directly at the jail. The committee did not recommend full funding for this position because the ASO anticipates receiving True Blood grant funding from the state to cover the costs of this position. And then moving on into the certified peer counselor request, this is for one FTE. This would allow Thurston County Jail inmates to obtain peer support in addition to behavioral health services that would assist their transition back into the community. The committee recommended 100% funding in 2025 because again, the ASO anticipates being able to support this position with True Blood grant funding in 2024. And then lastly, for the JBHP request is a reentry specialist. This is one FTE. This would allow them to serve an additional 25 inmates with reentry services, helping them transition back into the community. And they did not recommend full funding for this, and they, again, because of the True Blood funding. The next request is from wraparound.
Hold on a second, so, when are we gonna know about the True Blood funding and whether it's gonna actually do what is being speculated it might do? What's the timeline and matchup on that?
Yeah, I think that's a good question. So when I was going through this process with the committee and getting all of the recommendations put together, I did get to speak with Joe Avalos, who did confirm that yes, we do know that we're gonna be receiving this. It just doesn't line up with the county's biennial budget process. So they still submitted a TST request since it didn't line up because they still have needs, and just in case for some reason the process didn't line up, they still wanted to ask for those funds. So I don't have a solid date of when they'll be getting it, but they do know that they will be getting it. For wraparound with intensive services, this is a program that supports families with children ages 5 through 20 who are at high risk of criminal justice involvement. And so there continues to be a wait list for these services. It's very intense. They have over 20 youth and families on the wait list. The length of service is 9 to 12 months. So this request is to provide 4 additional Y slots to non-Medicaid youth on the wait list. And the committee recommended funding 2 additional Y slots to provide funding to support other recommended ASO requests, including workforce retention, which is the next one. This last request from the ASO is to allow an increase in behavioral health workforce and retention of clinical staff working in correctional settings. And so these staff positions are difficult to fill. They typically have a high turnover. They also anticipate having increases in professional liability insurance due to the nature of the work being performed. And so they're requesting workforce retentions. This would be training, supervision, internship stipends, $125,000 for that piece, 6% cost of living increase for staff and corrections facilities, so that's about $180,000. And then that increase insurance costs of $105,000, so the total ask is for $410,000 per year. The committee recommended funding half of the request for the cost of living increases, so that's $90,000 per year, so that they could stretch the funding to support the proposals for additional staff and the 2 additional Y slots.
So I want to go back to I'm sorry, I'm hung up on the True Blood thing. So my understanding of True Blood is that it relates to folks who are deemed legally incapacitated, which is a very small subset of folks. And that's not going to cover, I mean, if there's a need for a reentry specialist and a substance abuse disorder professional, you know, that covers almost everybody in the jail. Versus what I guess what I'm questioning is I'm gonna need information from Joe or someone that to explain to me that a True Blood grant would cover a reentry program for all the folks that would need reentry services in the jail or substance abuse. Cause that seems to me to be a much broader group than what True Blood's about. True Blood's only helps, I mean, I would think True Blood folks are like, I mean, probably it's more than it should be, you know, but it should be like 1% of the people in the jail. It's probably more like 8 or 10%, and that's too many, but that's what True Blood's all about, is we got too many folks like that caught up in the jail. But it's way smaller than the number of people that are in need of substance use disorder and reentry. So if the explanation to me is, oh, you don't need to worry about that because True Blood's gonna cover it, I need a little more information to give me the confidence that that's true.
Okay, yeah, we'll follow up on that. All right, how many more slides do you have? I think one more.
One more.
Okay, this last one is for to establish the Thurston County Court Alternative Program. And as you're already aware, this establishes a diversionary court modeled off of the San Diego County Homeless Court. And so some background to this, in July, all offices and departments are invited to present their programs and budget requests to the committee. This gives them an opportunity to ask questions, follow up. And there was no presentation for this request, and so the committee did not feel like they had enough information to make a recommendation for funding in this cycle. And that concludes all of the budget proposals for TST for this biennium.
And just as a heads up for the Thurston County Alternative Program, I had mentioned at the presentation that it was for a position. The funding is not for a position. I think what we're gonna be requesting is that a classification be opened or be established, created, thank you, I was like, what's the word, it's too late. Be created, and Leah is applying for grants to be able to fund that position, so what this funds would do, it would be to create kind of like a honeypot for the service providers and kind of, in an effort to kind of sweeten the deal a little bit, and so what I guess I'm gonna be requesting is, you know, since it is gonna be used for grants, that maybe it can come from that community grant awards pot, since it is going to kind of be using for the same kind of method, so.
Great. Well, thank you so much
Sounds like we
for,
got some more information to pick up at a later date here anyways.
thank you so much for your time. Really appreciate it, and thanks for all your work on the budget.
Okay, it is 4:32. Nicole, anything?
Just wanna say that this is the culmination of a 2-week period of presentations from offices and departments going through the budget. So I just thank all of the offices and departments who showed up and presented their budget to the board, and that we had the opportunity to have tough conversations, but get through those conversations, and there's more to come. October 23rd, we will start deliberations, and look out to the budget website for additional information concerning the budget.
And we do have one more presentation starting on the
23rd.
23rd with the clerk. Okay, and that should be our last presentation.
Yes, 9:15.
Okay,
And then we'll start going through the lists.
okay, well, commissioners, you get a 1-week break from budget.
Sort of.
Sort of.
Maybe.
Except for the fourth amendment.
Except, okay, okay, we're adjourned, thank you.